Turn it out. To the left. Take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha now, y'all. Now it's time to get funky. To the right now. To the left. Take it back now, y'all. One hop this time. One hop this time. Right foot, 2 stumps. Left foot, 2 stumps. Slide to the left. Slide to the right. Crisscross. Crisscross. Cha-cha real smooth. Let's go to work. To the left. Take it back now, y'all. 2 hops this time. 2 hops this time. Right foot, 2 stumps. Left foot, 2 stumps. Hands on your knees, hands on your knees. Get funky with it. Oh, yeah. Come on. Cha-cha now, y'all. Turn it out. To the left. Take it back now, y'all. 5 hops this time. Right foot, let's stomp. Left foot, let's stomp. Right foot again. Left foot again. Right.
Pleasant morning, good afternoon, and good night to all of you who are joining us from various parts of the world. Hearty welcome to Day 3 of the 14th Annual National Health Research Conference of the Ministry of Health and Wellness, Jamaica, bearing the theme, Taking Responsibility, Our Health and Wellness in Focus. Thank you for joining us here as we hail you from the sunny Isle of Spring, land of wood and water, Jamaica. Today promises to be a very exciting one, with the lineup of very intellectually stimulating panel discussions and virtual networking sessions. But without further ado, let us with hearts of reverence and gratefulness welcome the opening prayer, which will be delivered by Mr. Stephen Davidson, Director of Public Relations and Communication in the Ministry of Health and Wellness.
Let us pray. Lord, we thank you for this new day that you have given to us. We thank you that we have reached the 3rd day of the conference. We ask for your continued blessing on the presenters, on the research, and all the proceedings that will happen today. We pray for continued safety of all of Jamaica and all affected by the weather. We just invite your presence to be with us. We pray that you will continue to bless each of us and to remember our families at this time. We give you thanks for your mercies in advance. In Jesus' name, amen.
Thank you, Mr. Davidson. Amen. Welcome to feature presentation 4, which will inform reproductive health, pregnancy in older women. As you may be aware, the World Health Organization defines reproductive health as being a state of complete physical and mental social well-being, and not merely the absence of disease or infirmity in all matters relating to the reproductive system and to its functions and processes. Stay tuned as we crave your undivided attention to presentation from this panel discussion. We have an esteemed panel of gurus, namely Professor Afet McCaw-Binns, Dr. Orville Morgan, and Dr. Carol Lord. Our first presenter possesses sound quality knowledge base in the field of reproductive health and epidemiology. She wasted no time in her invaluable contribution, thus enabled scope for strong policy program research interface in the field of sexual and reproductive health and epidemiology. Professor Afet McCaw-Binns' research and service have focused on measuring and improving maternal morbidity and mortality globally, including Jamaica. This includes development of maternal mortality surveillance and response systems, as well as specialist antenatal care for high-risk mothers in Jamaica. Although retired from full-time academic life, Professor McCaw-Binns continues to live up to the meaning of her name: humanitarian, intelligent, healer, inter alia. She participated in the COVID-19 surveillance activities, particularly its impact on communities, antenatal women, and new mothers. Professor Afet McCaw-Binns has been integral in being a part of the ministry's national COVID-19 research agenda and research activities. Ladies and gentlemen, put your hands together and welcome Professor McCaw-Binns.
Went to a family event recently and somebody said, "Were they talking about my sister?" So this sounds like, were they talking about me? But anyway. Good morning, everyone, and thanks for being here in spite of the limited sunshine. I guess as a career elder, it is only fitting that I was asked to review the evolution of pregnancy in women of advanced maternal age, as I prefer to call them. The presentation was prepared in association with Dr. Georgiana Gordon-Strawn. Whoops, this thing's not moving. I will explore how the population of women giving birth has changed over my 40-year career and look at which complications of pregnancy more adversely affect older than younger mothers. Hopefully, this will set the stage for Dr. Morgan's discussion of how the health team may need to reimagine delivery of antenatal and intrapartum care to better serve Jamaican women giving birth in the 21st century. For those that are not in maternal health, we have to define things. So while pregnancy should really be a joyful event, complications and adverse outcomes do occur. We count as maternal deaths those arising during pregnancy and up to 6 weeks after the delivery. They include direct complications of the pregnancy itself, as well as indirect deaths from medical conditions aggravated by the physiological effects of pregnancy. While deaths from accidents and violence are not considered maternal deaths, we monitor them as they are highly preventable. Also not counted but monitored are late maternal deaths, which result from complications of pregnancy but occur more than 6 weeks after the pregnancy ends. Between 1980 and 2022, births have declined an average of 50% across all parity groups. As high parity motherhood has become rarer, childbirth has shifted from young, lower risk women to include more women 30 years and older, with total births in this population relatively stable since 2010. Most of them enter pregnancy with pre-existing conditions like obesity, essential hypertension, diabetes, and heart disease, some of which are first documented during their antenatal care. This delayed start to childbearing and changing life goals over time have led to a significant decline in family size. Today, the total fertility rate is now below the replacement level of 2.1, and this has implications for sustaining future economic growth, maybe long after I'm gone. The highest risk age groups are adolescents and women 35 years and older. While adolescent births have fallen from 1 in 4 to 1 in 10 today, births among women 35 years and older rose from 7 to 16% and now make up 1 in 6 deliveries. Postponing pregnancy carries a risk of subfertility and this increases the need for assisted conception services. Once pregnancy does occur, routine primary care should be able to manage both the obstetric and medical conditions of not just pregnancy, but those which remain after delivery. Many late deaths were due to inadequate management of persistent medical, not obstetric complications. As adolescent fertility and mortality has trended down, the proportion of births and deaths among older women have increased. Having 5 or more children has been associated in the past with adverse maternal outcome. However, the contribution of this demographic group to births and maternal deaths has been declining. Improving maternal mortality ratios among older women, the red line, began reversing somewhere around 2013 to 15 and are now twice as high as that of the younger cohorts. The upward trend of adolescent maternal mortality ratio, shown here as blue or black, needs investigation and attention. The remaining slides focus on 2019 to 21, which included the first 2 years of the COVID-19 pandemic. 1 in 4 deaths during this period were among COVID-infected women, with most occurring during the 2021 Delta wave. They included direct deaths. However, the majority of women succumbed to complications of the virus and were therefore the bulk of indirect deaths due to non-obstetric infections. Now to our population of interest. While just 35% of births occur to women 30 years and older, they accounted for 57% of deaths. When we compare the experience of older with younger mothers during 2019 to 21, those 30 years and over were 2.5 times more likely to die than younger mothers, especially, and this was due to either the direct conditions, indirect NCDs, as well as non-obstetric infections. Excluding the COVID deaths only reduced the risk ratio by 20% from 2.45 to 2.24. While the 3 leading causes of direct death were the hypertensive disorders, obstetric hemorrhage, and abortive outcomes, hemorrhage replaced the hypertensive disorders as the leading direct cause among older women during the pandemic, with their risk of hemorrhage death 4 times higher than among the younger women. Women over 30 were also more likely to die from COVID-19, the leading indirect cause during this period, as well as from cardiovascular disorders. Now let us look at some risk factors. The 3rd Jamaica Health and Lifestyle Survey identified the contribution of obesity as an important variable increasing adverse complications. They documented that as the non-pregnant population of women advance through their reproductive years, their prevalence of overweight and obesity increases significantly and was between 75 to 85% among women 30 years and older. Alongside overweight and obesity, 17 to 54% of women over 30 were already hypertensive and 8 to 22% diabetic even before they became pregnant. This means that we need to screen all overweight and obese antepartum women for these conditions at their very first visit and initiating treatment as appropriate. Clinicians sometimes assume that these pre-existing conditions are gestational in nature and fail to continue treatment after delivery, contributing to the excess of late maternal deaths in this population. So, to wrap things up, the maternal mortality trend from 1981, when we started measuring onward, showed modest improvements between 1993 and 2018. If we compare the recent review to 2010-15, the period with the highest MMR from that era, the risk of maternal death was 68% higher than expected. excluding COVID deaths, resulted in a risk ratio still 28% higher than the norm, suggesting that the quality of maternal care may have been compromised by the stressors associated with the pandemic, with older mothers the most likely victims. As more women pursue tertiary education and careers, they delay childbearing into their 30s and beyond, with many entering motherhood with a range of pre-existing conditions that increase their risk of complications such as the hypertensive disorders, cardiovascular disease, and infection. As total fertility declines, we need to reimagine routine antenatal care so that this growing population of older, often employed and higher risk expectant mothers can receive excellent care near where they live and work and experience safe, healthy, and happy outcomes. Finally, my colleagues in Geneva would be angry with me if I didn't position Jamaica within the global goal to reduce maternal mortality to below 70 per 100,000 by 2030. We need to reset from the pandemic setback. New strategies are required. It cannot be business as usual. I have said I'm not coming to any more maternal mortality surveillance meeting. I've been going for 40 years and nothing. Me done. I feel no time now. So this target requires a reduction in annual maternal deaths to fewer than 25 per year or 3 to 10 per region. Is Jamaica or even one region up to the challenge? Thanks for your attention and efforts to ensure that women and their babies survive and thrive.
Thank you, Professor Afet McCaw-Binns. As you heard her, it cannot be business as usual. We need to step up our game. Our next speaker is one of Jamaica's icon in obstetrics and gynecology and was awarded the prestigious Order of Distinction in 2015 for his invaluable contribution to medical sciences. Dr. Orville Morgan is a consultant obstetrician and gynecologist who is now in private practice. He served as the senior medical officer at the Victoria Jubilee Hospital from 2013 to 2018. He was instrumental in establishing the Maternal Fetal Medicine Specialist Unit, upgrading the neonatal unit to offer ventilatory services for the newborn, designing the High Dependency Pregnancy Unit and the Neonatal Intensive Care Unit funded by the European Union. Thank you, sir, and thanks to the European Union. Dr. Morgan is the co-author of several peer-reviewed journal articles in areas of misoprostol use and HIV in pregnancy. Ladies and gentlemen, do you know what that means? It means that he has not been keeping to himself groundbreaking research, but rather share it with the world. He has made significant contributions to reducing the vertical transmission of HIV. He has also worked on studies involving the Zika virus vertical transmission. These studies were funded by the Penta Foundation. Thanks to the Penta Foundation. This remarkable gentleman, who is also a Justice of the Peace, is a founding member of the Mona Baptist Church. This speaker, ladies and gentlemen, continued to live up to his name, associating with that which is golden. Let us welcome him heartily.
Good morning, all. I want to thank the organizers for inviting me to participate in what I hope will be a very robust discussion on the problems of the older woman as we seek to take responsibility for our health and wellness. I think that this is a very timely topic to discuss, because this is a problem that, for the reasons that has been outlined earlier by Professor McCorbins, it's not going to go away. This is a problem of, as we formulate our society to have women participating more and more at the workplace, they'll put off childbearing to later and later. Often, the career-driven woman goes on, and it's when in her mid-30s, she suddenly decides that, you know what, I really want to fulfill my maternal instinct. I really want to get pregnant. And that does come with problems. So basically, the problem won't go away until society reorganizes itself in a certain kind of way. And one can argue whether we are going against the biology by organizing society the way we have done. And that's a different argument. For this time, I'm just an obstetrician who is here to deal with the problems that come on with the problems that are associated with these things. Which one is this? Okay. All right. So my objectives are, very simple. I just want to describe, and then we hope that, and suggest some things, and then we hope that we can have a discussion as what makes sense and what doesn't make sense. This discussion has been going on for over 30 years, right? And it is a discussion that is going to go on for a long time. It's a discussion that has reached crisis proportions now, because it's not only in Jamaica that we see this problem, or it's a global problem. And these are just some figures from elsewhere, all right? 1980, England and Wales, 6% of pregnancies, all pregnancies. And by the way, from an obstetric point of view, we define advanced maternal age as 35 and over. I noticed that a lot of the work that we do in Jamaica is from 30 years and over. And maybe we have a different demographic, but that's a different thing that we need to sort out. But nevertheless, even in Jamaica, the problem is 7.4% in 1985, to now about 16.4% of all pregnancies are in this age group. So it is a growing problem, meaning that more and more women are getting, the average age of pregnancy has moved a long way. For the United States, the average age has moved from 21 to 28. So this is how the problem. But it is not just a problem just because it is like that. We have already mentioned that there is decreased fertility as you get older. Unfortunately, also, there's an increased risk of miscarriage. The increased risk of miscarriage is such that in a 25-year-old, the risk of miscarriage is certainly less than 8%. By the time a woman reaches 35, that risk is 25%, and it exponentially increases so that by 40-something, it is 50%. They have smaller babies, both because of iatrogenic, meaning that we deliver them earlier for obstetric reasons that we're going to discuss a little bit. But also, these babies, there's some degree of placental insufficiency, and so these babies are generally smaller. There's a slight increased risk of preterm birth, but iatrogenic preterm birth is quite common for obstetric reasons. There's definitely an increase in stillbirth. So all of this has to do with really the quality of the oocytes. As you may know, the quality of oocytes, that is, what starts up that pregnancy, is poorer the older the woman gets. it's not really good when they are young. So we don't want them too young, because if you follow that curve, it's a U-shaped curve. You get a poor quality before 20, and poor quality again starts after 32 or so. So there's increased risk of unemployed, meaning things like Down syndrome and that sort of thing. So these are some of the problems that, in terms of fetal outcome, that have come. There is increased risk in terms of bleeding problems. Both abruptio and placenta previa is increased with the older gravida. There's increased risk, and we hope we'll get to discuss some of these things, of hypertensive disease, of diabetes. The C-section rate is increased in this group because of obstetric anxiety, as well as really there are problems with dystocia. And of course, the increased risk of death, which we will elaborate a little bit more on. So this increased risk of death is quite dramatic. All the studies, not most, all studies everywhere in the world, it's not just Jamaica, have shown that once you get the older gravida, there's an increased risk of dying, regardless of how well they are managed in whatever setting. They have a 3 times increased risk of dying. And this was earlier studies in the United States. Let me look at our studies here. The mortality trends, even if we take out the COVID, it's almost 3 to 1. That's Professor's slide. And this is from the United States. You notice, especially in the 40 and over, how dramatic that looks, right, in terms of rate. Under 25, 20.4. 40 and over, 138.5. Of course, we are near there in our normal population. This is Victoria Jubilee's figures for 2023 in terms of age-specific mortality rates, right? And you will see that they didn't have any deaths of patients over 40 because they had probably 5 or 6 for 2023 so far. But the significant, and we look at the mortality ratio, maternal mortality ratio, because in a sense we are expanding out these figures. The raw data is like 5 or 6, but that is too many, right? But you can see clearly in our society what a vast difference age makes to maternal mortality ratios, right? So what do we do, right? And I guess this is the slide that we should just focus on, what we are going to do, because just all of this was just building up what is the problems. I have suggested, and others with me, that we need to, first of all, get all these women who want to get pregnant over the age of 30 and beyond to optimize. In fact, all women should have pre-pregnancy care, but especially women who are older must get pre-pregnancy care. This should be the norm, all right? So this is going to mean that the collaboration between primary care providers and obstetrics should be a little bit closer, because that's the only way you're going to pick up all of these women who are going to clinics for their hypertension, their diabetes, and yes, they want to get pregnant. That's a discussion that the general practitioner should have with the woman, and we should get them organized. So pre-pregnancy optimization is a key factor, I believe, before things. We have no studies yet, but I can just talk about the small amount of patients that actually went through this system, and in general their outcomes, and not one of them, first of all, died. and this, I'm just speaking generally, I have no direct figures now to share with you, all right? But this was the thrust of what we had wanted to do. Get them to see the doctor long before they decide to be pregnant. Collaborate with the medical clinics. Go to the medical clinics. All the women that are in reproductive age group that are being seen for whatever chronic disorder should be referred to see the maternal fetal specialists, and we have enough of them to go around now. So that they should be quite busy organizing these women, and it needs other members of the healthcare team, because it is one thing for doctors and nurses to prescribe, is another thing for patients to translate that into action. So the whole organization of healthcare needs to be improved. Maternal mortality ratio is often taken as an index of the healthcare of a population. And it is a worthy index because if it is telling you, and what our figures are telling us, that all that we have done over the last 40 years has not been good enough. That's what it is telling us, basically. All that we have done, we have not really organized healthcare properly, because in any organized healthcare, that's one of the first indicators that you will know that you see your maternal mortality ratio start to fall. And we have just been shown that it has virtually remained the same. And we need to look at that. I'm particularly alarmed as an obstetrician that the direct cause of maternal deaths have not changed in terms of the ratio. And that is something that is in our purview. You know, it is okay, we can't talk about and deal with the other issues, but certainly things like hypertensive disease in pregnancy, things like hemorrhage, which are the major causes of maternal deaths, are things that we should have had a handle on long ago. It only speaks to the fact that we are disorganized and, and we have not set up the system, because when we have a problem from a management point of view, we have not, and all of the people that are involved, if you see them one-on-one, are capable, in quotations, of managing. Why is it that collaboratively we are not capable? And it speaks to how we organize ourselves in providing care. Other issues are there for us to see, but I just want to whet your appetite in the discussion. Of course, we can discuss more and more. We can discuss for hours at length. Any one of these topics are proper research protocols. If you see the studies that have come out, for example, looking at hypertensive disease and what can we do about it. And so we need to be thinking more. And just to emphasize, not going away. This is what has happened in the world. 74-year-old with twins. Thank you very much.
Thank you so much, Dr. Morgan. Put your hands together again for the speaker. Pregnancy in older women. Our next speaker will be joining us online. She is Dr. Carol Lord, currently the Program Development Officer in the Family Health Unit of the Ministry of Health and Wellness, having served the ministry and the regional health authorities in other capacities. She is currently at the final stage of completing the Doctorate of Public Health program. Hearty congratulations, Dr. Lord, and I wish you well. She is a successful holder of a Bachelor of Medicine and Bachelor of Surgery degree in 1998 from the University of Guyana. Dr. Lord has authored research papers in infectious disease, pediatrics, and maternal health. Another speaker, ladies and gentlemen, who endeavors to share her phenomenal work through research. Dr. Lord, whose name depicts joy, you hear it all the time at Christmas time, joy to the world. She is passionate about public health, pediatrics, obstetrics, and research. She is a mother of two wonderful young adults. Let us welcome Dr. Carol Lloyd.
Problem within the room because those who are hearing me. Please ask Prof. Crawford. Oh, what should we do? Should I continue? Let me call and see what is happening if they're hearing in the room. Are you hearing in the room now?
Yes, we're hearing you now. Thank you.
Thank you. Okay, the cutoff age is not uniformly defined. And so for the advanced maternal age, it is greater than or equal to 35 years. And even further has suggested they have looked at the very advanced maternal age as greater than or equal to 45 or even 50 years. And so the ages are continuing. In Jamaica, we use it as 35 years and older. Our data collection record, though, we use as 30 years as we look at our antenatal care, at our antenatal information collected through the system, our healthcare system. So some of these complications that we see when we look at the risk, this presentation focused mainly on the risk. And so when we look at the risk, we would have heard from Prof. and Dr. Morgan of them having spontaneous abortions, them going on to have ectopic pregnancies, fetal chromosomal abnormalities. Some of them may have congenital anomalies. We heard the details of the obstetric complications, including increased cesarean birth, and with increased cesarean birth comes the increase in preterm births. What the studies have actually revealed to us is that those of advanced maternal age, they do not have there's not an increase in the neonatal deaths. There's increase in preterm birth, but there's not an increase in neonatal death. All right, and there's also an increase in the perinatal mortality rate because of increased stillbirth and increased preterm birth that this cohort of women will experience. In fact, there was a cohort study that was done comparing women less than 47 years and younger to those over 48 years. And what it has revealed is that there was a 3-time increased risk in cesarean birth, a 4-fold increase in the gestational diabetes, a 6-fold increase in the risk of requiring blood transfusion once they're admitted to hospital, and a 33-fold increase in intensive care unit admissions, HDU admissions, in that they have complications, life-threatening complications. So let us look at this young lady. This young lady is Miss A.G., a 52-year-old who presented to accident and emergency at a hospital I was working some years ago. She presented with severe abdominal pains and swelling of the hands and feet. She had an unremarkable past medical and surgical history, and she had, in her obstetric history, she's gravid 7, para 8 with 1 set of twins. She was unable to say when was her last menstrual period. On examination, she had a blood pressure of 156 over 96 with a BMI of 26, a very slim woman. But what she had was abdominal distension, her abdomen as well, and she had a pedal edema in addition to proteinuria. So any officer did an abdominal ultrasound and saw a twin gestation, and she was sent to the labor ward. At the labor ward, she was in labor. She was diagnosed as a grand multip with preeclampsia in labor with twin gestation. And as soon as she got into the labor ward, it was within a few minutes when they contacted pediatrics that I was involved at that time, that we realized that what the abdominal pain she was feeling was that she was in labor. And so she delivered a set of twins. And I must say, the babies were 2.5 and 2.7 kilograms. It remains so vivid in my mind that this lady who thought that she missed her menses because she thought she was in menopause was actually pregnant. This means she had no antenatal care, and she just presented like that. Well, you know what happened thereafter. So with the complications that we would have listed, that Prof would have identified, these persons come in with pre-existing conditions. Dr. Morgan has identified that they have so many complications, so you know that what would have happened to her. So when we look at our information here in Jamaica, these are provisional information with antenatal visits in those 30 years and older. We found that they make up about 27.7% of the first antenatal visit. This information is from their first antenatal visit. So what you see here is what they came into antenatal care with. Most of them coming with anemia, with an HB less than 10. We use HB less than 11. I went down to 10 because we had 25% of them coming in with HB less than 8. It means when they're going to seek antenatal care late and coming with an HB that is low, that they are at increased risk of further complications. All right? You see that they come in with the syphilis positive confirmed 40%. The immunization is 25%, fully immunized with tetanus. But if we notice in terms of the gestational diabetes and preeclampsia, as Prof was making reference to, 45% of them will have gestational diabetes with over 30, and 35% with preeclampsia, the hypertensive disorders in pregnancy. 34% of them referred to the high-risk clinic. And we also had 30% of them, of those who were referred to hospital because of complication from the antenatal care, 30% of them had complication even at their first antenatal visit. This is their booking. This is from the NCSR. And so this is in keeping with what they surveil as they look at the maternal death. Well, you have the details of this from Prof. McCobbins and Dr. Morgan just now, where we find the direct deaths, where we have the hypertensive disorders, the obstetric hemorrhage, and the embolism now forming an increased priority in terms of our maternal death, and the indirect death, the circulatory and the sickle cell disease. All right? What I want to say to us in terms of the solution, we thought it should be an all-government approach. This an all-government approach is important. We need to target the lower age group now, between the 18 to 30-year age group within our population. We need to ensure that these women are optimal with their care in terms of their diet, in terms of their physical activity, in terms of there's a physical activity handbook that we just put out in collaboration with the HPPB branch for the pregnant women. All right, and they have access. They have access to healthcare. They have access to information, and so we want to improve on that. One information we had we have for our pregnant women is the maternal record booklet. And this is what it looks like. I thought that I can share this with you. This is what every pregnant woman in Jamaica would have in their possession, whether they're going to the private or to the public antenatal care. And within this book, it has information as to when they are considered high risk and when they should be referred to a high risk center. And so this is important in that they are empowered to know what is happening. And so we find, in summary, even though we have advanced maternal age is increasing in our population, we just need to have a plan for them. They must have a care plan. And this book offers a section that once they see the obstetrician or the healthcare provider, that they have a plan as to how the pregnancy should progress, and that should be documented. All right. Know that they have found actually that children of the persons of advanced maternal age is not all negative, that those children are even more stable, as they will consider it. But then we have other things to take into consideration. That slide I deleted. Other things to take into consideration in that with advanced maternal age is that the children will now have to take care of their advanced maternal age parents while they are still adolescents or even teenagers. And so that is one other risk that I deleted that slide. But just to say to you is that pregnancy complications occur in older gravida. The complications occur throughout the pregnancy. They can have a normal pregnancy with a plan, one that is planned, and the obstetrician or the healthcare provider can guide them through this process. And so I just want to say thanks to the Medical Information Director, Mr. Martin, his administrator, the specialist, Dr. Yo Alfred, and Dr. Alan Burton, Dr. Arlene Harris, and Prof with the 2 slides. Thank you.
Thank you, Dr. Lord. Thank you, Dr. Lord. The floor is now open for questions. Okay, there's a question over there. Can you provide her with the mic, please?
Thank you. Good morning, colleagues. Thank you for those great presentations. You know, As we have the date and we have identified that we have an issue, it is now important for us to look at how do we plan to mitigate some of the challenges that were highlighted. It is very important if we are to have best outcomes for all our patients. And one of the statements that was made is that pre-pregnancy, Doc, you mentioned pre-pregnancy care. And I thought about it because as somebody who has been in the field, one of the challenges we have is that a lot of our antenatal mothers, they never planned their pregnancies. And so how do you do that pre-pregnancy care for them if there's no plan to become pregnant? Majority of our women, there are some of them who plan, but majority of them don't plan. So I am thinking that maybe something that we need to, do general education on and include some of those pre-pregnancy practices in a general lifestyle practice format. Because I think that's the only way, considering our situation, that we would be able to get the folic acids, the other things that we should be doing on board prior to becoming pregnant if we are not planning to be pregnant.
All right. Good morning again. I can just take it quickly. I believe that what should be because some people are not planning, we should have a plan for them, all right? And certainly what has happened is that you have patients who are going to clinics, for example, diabetics, hypertensive. These are, I'm not talking about those that are coming off the street now. They are going to the clinic. As has happened, I worked at the KPH Jubilee Complex for many years. And they are over there, and they turn up to your clinic 20 weeks pregnant, right? They were going to clinic because there's a division of obstetrics and general medicine, right? Which ought not to have happened because what we attempted to do as a result of that is to be preemptive. So we went over there now, and the ladies who were in reproductive age group, we targeted them because the management of your diabetes and your hypertension is going to be different if you're getting pregnant, right? It is a little bit tighter, and the drugs you use is going to be different and stuff like that. You understand what I'm saying? But so we have to take the initiative and get to there. And of course, the general education. I think, people know me in my private discussion and say, look, what we're doing is stupidness. We're telling these women to go and study, and when they reach 40s, then time they come to have baby. It's rubbish, right? And it's wrong. We should encourage our women to have their children at a younger age. It's simple. That's a very simple advice, right? People don't want to hear that because the women have to do something. But we need to reorganize so that the women can achieve what they want to achieve as well, so that we can balance it, so that there should be a balance between reproduction and production. Okay.
Any more questions?
Well, I want to continue on the theme. You notice that the births among the adolescents has fallen remarkably. So we're doing health promotion and talking about lifestyle in the school environment. So what we need to do is expand the messages to speak about, well, these are the things you need to do to maintain your health. I get very scared when I used to look out my office on campus and see the girls walking around the campus, and they had a BMI of 40 at 19. And I'm saying, what are we doing about some of these issues that are going to change some of these risks in the population? So the health promotion, and there's a little kind of attitude about pregnancy. Only 32,000 births occur every year, so we can't nobody look on that thing. Let us look on something else, because those are more people that we have to worry about. And you know, I'm in primary care and public health. I believe that really prevention is easier than cure. But we are down here fighting the treatment and the care without dealing with the prevention in a more appropriate way. And the other point why I'm quitting is this notion that surveillance has to include a response. You are collecting data in order to respond. So my question is, where is the response to the maternal health challenges that we have been seeing over the years? That's why I now count no more dead man, because we're not responding to the information that is coming out of why these women have died. Thank you.
Thank you, Professor. Are there any more questions from the room? How about online? Any questions from persons online? Okay, no questions. All right, so we are going to wrap up. Ladies and gentlemen, you have heard it. The phenomenal works by our speakers who continue to pave the way for sustainable development through research, which will be continued by present and future generations. You know, when I was a child, I learned this thing from Khalil Gibran, the prophet. We work so that we may keep pace with the earth and the soul of the earth. For to be idle is to become a stranger unto the seasons and to step out of life's procession. And yes, this is a lot of work. So the presentation today, we're pretty much in keeping with the World Health Organization's ethos that reproductive health implies that people are able to have a satisfying and safe sex life, and that they have the capability to reproduce and the freedom to decide if, when, and how often to do so. Coming up, there will be a 5-minute break, during which we will have the commercials. This will be followed by feature presentation 5 regarding reproductive health and environmental pollutants. Then there will be the concurrent sessions, conference fun and giveaways, and the final feature presentation 6 regarding telemedicine and ethics, after which we will have the Jamaica Moves break and then the closing ceremony and awards. So stay tuned, ladies and gentlemen. We will be right back after the break.
Hello, I'm Dr. Shin Young-soo, and Regional Director for the Western Pacific World Health Organization. Today, on the World Health Day, I would like to ask you, how safe is your food? Does your country's food safety system protect you and your loved ones? Does it follow international best practice?
morning, everyone. As we complete our session, which was quite interactive and informative, we want to thank our special presenters and our moderator. And so at this time, we want to give small tokens of appreciation for the excellent presentations and moderations. And so we're going to begin with Prof. Afet McCobbins. Dr. Orville Morgan. And Dr. Tasmore Crawford for her able moderation. Thank you. We will resume our break period.
Safety must be a priority, from farm to plate. Governments must take responsibility and ensure that all foods comply with minimal food safety and quality requirements. Otherwise, the health and economic consequences may be serious. WHO helps member states build capacity to prevent, detect, and respond to foodborne disease outbreaks. This includes building national core capacities as required under the international health regulations and facilitating rapid exchange of information through the International Food Safety Authorities Network, managed by FAO and WHO. Make safe, healthy food a priority. Take responsibility to ensure food safety. This will help your country maintain good health and achieve economic prosperity.
I was first diagnosed with cervical cancer at age 33. The treatment was not pretty. It was terrible. I couldn't go to work, and I spent the whole 5 years out of work. The pain, the struggle, I removed my womb. I thought, I'm finished with cancer. 2016, cancer come back. There's hope for your daughter. My experience don't have to be her experience. So mothers, give their children the vaccine. It will be good for your sake and for the children's sake.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
I want to see a Jamaica that is cervical cancer free. Cervical cancer is one of the leading causes of cancer in women in our nation, and I want this to stop. The HPV vaccine has been proven to be the most effective method to prevent cervical cancer. It is a safe vaccine, and it is best to give the vaccine to young girls before they've even been exposed to the HPV virus. So parents, I want to encourage you to let your daughters get the HPV vaccine. Let us protect our next generation against cervical cancer.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
I love my children, and I will do anything to protect them. So that's why, as a mom and as a doctor, I made sure that my daughter got the HPV vaccine to protect her from cervical cancer later in life when she becomes a woman. The HPV vaccine is very safe and effective.
I was afraid of the injection at first, but I got it and it really wasn't that bad after all.
If there was something you could do to protect your child, wouldn't you do it? Protect our next generation. Ensure that your daughter gets the HPV vaccine today.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
What happened, Aiden? My mama told me I need to come off the tablet. Yes, you should. We need physical activity. Well, that's what the adults say. Adults, I tell you. Seriously though, with physical activity, we will get better grades, better heart health, and improve the bone health. Oh, I heard it will improve memory and overall mood. Yes, it will maintain our weight and lowers the risk for depression. Do you know what will lower your risk of depression? What?
During this time, with online schooling, we are sitting for too long. The problem with sitting for too long is that it leads to soreness, aches, and pains throughout our body.
We're gonna get funky, 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 funky. Everybody clap your hands. Clap, 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 clap your hands. Clap, 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 clap your hands. All right, now, we're gonna do the basic step. To the left, take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha, real smooth. Turn it out. To the left. Take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha now, y'all. Now it's time to get funky. To the right now. To the left. Take it back now, y'all. One hop this time. One hop this time. Right foot, 2 stumps. Left foot, 2 stumps. Slide to the left. Slide to the right. Crisscross. Crisscross. Cha-cha, real smooth. Let's go to work. To the left. Take it back now, y'all. 2 hops this time. 2 hops this time. Right foot, 2 stumps. Left foot, 2 stumps. Hands on your knees. Hands on your knees. Get funky with it. Oh, yeah. Come on. Cha-cha now, y'all. Turn it out. To the left. Take it back now, your foot, let's stomp. Right foot again. Left foot again. Right foot, let's stomp.
Is your wealth, so come we start the conversation. Make we rise and immunize all across the nation. The ministry is giving us the motivation to get your infants routine immunization. Protect the toddlers from all diseases. Tetanus, rubella, whooping cough and the measles. Polymyelitis, mumps and the flu, plus tuberculosis to name a few.
Rise to immunize. Eliminating diseases saves lives. Visit your nearest clinic or health center for more information or log on to www.moh.gov.jm. A message from the Ministry of Health and Wellness.
Do your part to prevent mosquito breeding. Mosquitoes will breed in any container that holds water.
Tightly cover water storage containers such as drums, barrels, buckets, and tanks. If this cannot be done, pour cooking oil on the water surface. Punch holes in all tins, plastics, and beverage boxes to prevent the collection of water before disposal. Cover all tires or fill with dirt to prevent water collection. Scrub all vases once per week to remove mosquito eggs. Use mosquito repellents to protect yourself from mosquito bites. Dispose of garbage properly by placing in plastic bags and securing properly to prevent water collection.
A message from the Ministry of Health and Wellness.
Come pre this you, don't pre that. Let me tell you about the body and some physical facts. Come pre this you, don't pre that. Let me tell you about the body and some physical facts. Physical activity defined as bodily movement. You know it beneficial to every student. Chin up, push up, jogging, sit up, feeling lazy. Better get up. Physical activity help your mood and memory, make you remember anything, cause it boosts dopamine and serotonin. Target attention, focus, regulate moods. Come learn something. Yeah man, listen young youth. Physical activity, healthier weight, go and exercise. Students hold the faith. The more you do, the more calorie your body use. Calorie deficit, calorie get reduced. Exercise build your bone and make it more dense. A facts we attack, ladies and gents. Physical activity is of the essence, needed like full stop in any sentence. Come pre this you, don't pre that. Let me tell you about the body and some physical facts. Come pre this you, don't pre that. Let me tell you about the body and some physical facts.
During this time, with online schooling, we are sitting for too long. The problem with sitting for too long is that it leads to soreness, aches, and pains throughout our body.
One, two, three, two more. 1, 2. Adults to 30 minutes activity daily. Love your body, treat your body right. Vegetables, make sure you eat plenty. Children do 60 minutes activity daily. Drink some water when you feel thirsty. Cut down dessert and have a smoothie. Jamaicans, love your body, treat your body right. One more time now. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. Listen up. Make sure you know your health status. Go a doctor and get a regular checkup. Chronic disease can slowly creep up. We can lower the risk and live up if we just eat right and get moving. Jumping, running, dancing or skipping. Change the children, them lazy habit. Make them play out the door and put down the tablet. Jamaicans, love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. After 2, make me hear you say I love me. 1, 2. I love me. 1, 2. I love me. 1, 2. I love me. After 2, make me hear you say I love me. 1, 2. I love me. 1, 2. I love me. 1, 2. Jamaicans, love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. One more time now. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. Jamaica get moving. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. One more time now. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. Listen up. Love your body, treat your body right. Love your body, treat your body right.
Good morning. Welcome back to feature presentation number 5 at the 14th Annual National Health Research Virtual Conference. We will look at reproductive health and environmental pollutants. In recent years, numerous studies show that exposure to environmental air pollutants affected reproductive functions and, in particular, produced adverse effects on pregnancy outcomes, fertility, and health, and environmental fertility and the environment. And the privilege is mine to introduce our presenter for this morning, Dr. Leroy Campbell. He's online. Dr. Campbell, I'm pleased to say, is very much affiliated with the Family Health Unit at the Ministry of Health and Wellness. He is the founding chair of the Maternal Health Guideline Development Committee, which commenced in 2019, coordinated through the Family Health Unit. And I want to just use this opportunity to mention the leadership of Dr. Ennis and Dr. Lord for this committee. And I want to use this opportunity to highlight Dr. Leroy Campbell's passion for the development of standards of care for maternal health services, especially those standards for outcomes that contribute significantly to our maternal mortality ratios. So we extend our gratitude to him on behalf of the Ministry of Health and Wellness for his invaluable service in this area. Dr. Campbell is a consultant obstetrician gynecologist and the deputy head of the Department for Women's Health in the Cayman Islands Health Services Authority. He is a fellow of the American College of Obstetricians and Gynecologists and created history by being involved in 2 of the first successful surgeries on unborn babies in Jamaica and the Caribbean. Dr. Campbell is an alumnus of the Campion College and formerly served at the Victoria Jubilee Hospital as consultant and academic program coordinator. He is also the co-host of Beyond the Diagnosis, a radio program on Nationwide News Network 90 FM. And notably, Dr. Campbell was a 2-time Poster Award winner at the National Health Research Conference in 2020. So please let us welcome Dr. Campbell, who is joining us virtually from the Cayman Islands. Dr. Campbell?
Yes, thank you so much, Dr. Porter, for that introduction. I want to thank the organizers for giving me a chance to share and to serve in this capacity. Seeing a lot of familiar faces of friends and mentors. So I'm really grateful. I'm particularly excited and happy to share on this topic. I hope you're seeing my screen of reproductive health and environmental pollutants. Simply because I think this is an extremely important topic in this day and age. I think most of us have been aware, based on the information that we have received, that fertility rates locally and globally have actually been on the way down. In fact, the data from the World Bank suggests to us that since 1960, global fertility rates have been cut in half, right? So even though the world's population is as high as it has ever been, the fertility rates are on the decline. And for the most part, we have attributed this to the availability of contraceptive methods and changes in laws as it relates to termination of pregnancies, etc. But the truth is that is not enough to explain what we're seeing. Simply because most of the contraceptive methods are taken up in terms of, when we talk about uptake of contraception, we know most of it is on this side of females, okay? We are yet to have effective non-permanent contraceptive methods outside of barrier methods for males. And in spite of that, in addition to the fall in fertility rates, we are also seeing a decline in sperm counts globally. Okay, and this is actually taken from a study that looked at population-based samples over since 1970s in different groups within the United States. And what was observed was that there was over 50% decline in sperm counts over that period. And the question, of course, is why? Now, when we look at the data coming from the Federal Reserve as it relates to the production of chemicals in the United States, what we realized over that time, you will find that during that same period, the volume, the quantities of chemicals being produced increased. And if we were to superimpose on that graph of the increasing rates of chemical production in the United States, you will realize that as chemical production increases, sperm counts have fallen. So as the chemical production had increased, sperm counts had fallen. And as a result, it raises the question of a relationship and an association. Attributed to John Muir, the famed American zoologist and botanist, explorer, mountaineer, very knowledgeable as it relates to nature. And I think this quote is profound because it points to the fact that whenever we disrupt anything within nature, it is going to have an effect that extends beyond the actual thing that we're disrupting. So everything, therefore, in nature is related. And I think this is something that we have come to appreciate more and more with time, with observation of issues such as global warming and deforestation, etc. Now, when we talk about the environment, and it's very important for me to set the framework of what we're discussing here, and we talk about the environment and pollution as it relates to the environment, it's easy for us to focus on environment in the context of the general environment, population, etc. But we must understand that there is both a personal environment, this is the space around us that we are in immediate control of, and then there is the global or global environment, and we're speaking now to the space that is influenced by others within the population, and that we can't per se control, okay? Now, when we look at the relationship as it relates to the environment and pollution, and we understand that there are varying sources, both domestic and industrial, and much of the waste products that are produced will end up into the ground, seeping through down into the water sources, whether it be the water table from which we're going to dig down to get wells, or into our rivers, or into our streams, which eventually end up into our seas. We also have air pollution, which essentially is exposing us to toxic substances or potentially toxic substances within the very air that we breathe. So you'll realize that we have the capacity to be exposed to pollution in many ways. We can be exposed transdermally through our skin. We can inhale pollutants that are present within the air, and we can also ingest pollutants that may be present within the food that we eat, okay? Because of course, if the water is polluted, then the fish will concentrate these toxic substances, and when we eat the fish, we in turn receive them, ingest them. If the soil is polluted, then the plants and the animals will begin to concentrate these substances, and we can consume and therefore be affected. And then, of course, it's very important for us not to neglect the significance of the personal environment, what we can control, you know, what we use on our skin, the candles that we use, you know, what we use in our homes, the makeup, etc. And if we think about that, then we understand that those also may play an important role. So when we talk about reproductive health, we're talking about sex and the ability to reproduce. And most of us will understand the importance of the genital structures, both internally and externally. But it's also very important that we understand that these structures and the function of these structures, whether they be the gonads, which produces our gametes, for men's sperm and women oocytes or eggs, all of these structures are influenced and controlled by the brain via hormones. Okay, so this is what we call in medicine the endocrine control of these organs. Okay, and naturally, if there is a hormonal system controlling fertility and reproduction, then factors that can disrupt these hormones may also play a role in affecting the reproductive function within humans, whether males or females. And these are referred to as endocrine disruptors. And then, of course, we have substances that may be directly toxic to our gametes and substances that may affect not the gametes per se, but may affect the fetus. Whether it's toxic to the fetus, leading to fetal death or miscarriage, or they are what we call teratogenic, meaning that they have the capacity to induce malformations, congenital abnormalities, or they may be carcinogenic, meaning they have the capacity to increase the risk of cancers. And of course, we are seeing increasing rates of childhood cancers. Now, most of us would be familiar with the effects of heavy metal poisoning. In fact, one of the oldest, most well-known examples of the effects of pollutants on the human health in particular is as it relates to heavy metal poisoning, specifically lead poisoning. In fact, some historians have attributed the fall of the Roman Empire to the invention of lead pipes for transporting fluid water in Rome, leading to increase into madness and fetal issues and a whole host of things. Now, you'd have thought that those issues were issues of the past, but the reality of it is that it's still present with us. And some of us will be familiar with the case of Flint, Michigan, which gained, and still has great popularity in the news media because of water that was contaminated with pollutants, in particular high levels of lead. Many movie stars and different celebrities have rallied behind the Flint, Michigan situation. And one of the things that first pointed to the issue in Flint, Michigan was actually observations by researchers, particularly Grossman and Slutsky, that there were changes in fertility rates and there were increases in adverse pregnancy outcomes, right? And this was really what started to, one of the factors that began to say that there is something that's going on here. And when you looked at the data, the fertility rates decreased by 12% among Flint women, and fetal deaths increased by almost 60% after the water source was changed from the Detroit River to the Flint River in Michigan. And so this is what kind of highlighted that major issue and brought it to the attention of the wider public that there was something going on here, and that is still a work in progress. The other thing that we perhaps need to be very much aware of are the effects of agricultural pollutants, particularly pesticides and herbicides. And the evidence suggests to us that even for persons who are not involved directly with the use of pesticides, just living in close proximity to an area of high agricultural activity, in which pesticides and herbicides are being used is associated with an increased risk of ovulatory dysfunction, infertility, miscarriages, fetal death, fetal malformations, and childhood cancers. Just the proximity to these areas increases the risk. And so, of course, this cannot be ignored and therefore has to be looked into. I think many of us can identify with these pictures. Somewhere around 2015, we started seeing these pictures popping up on the internet of babies with microcephaly coming out of Brazil. And the question at the time was, what was the cause? And of course, the Zika virus was confirmed by the CDC to be the cause of these cases of microcephaly. And at the time, if some of you would have remembered, there was great fear and concern as it related to this observation. And I remember at the time, one of the recommendations from the Ministry of Health was for women to delay childbearing for at least a year or two until this pandemic had run its course. But one of the things that was observed with the Zika pandemic is that as it began to move northward in the Americas, we were not seeing the same rates of microcephaly as were being documented. Our patients here in Jamaica, we saw nothing compared. We looked at women here doing anomaly scans, booking scans, anomaly scans with Prof. Christie and her team from the University of the West Indies, and we did not see the kind of numbers, the rates that were being seen in Brazil. And the question was why? What was so unique to Brazil that was causing them to have these high rates of microcephaly in the context of Zika virus? And it was not until researchers there started to look at a relationship between a particular pesticide, pyriproxyfen, with microcephaly, that the answers became more and more clear. And subsequently, this has been studied quite widely, particularly a group in France recognized that what was happening was that pyriproxyfen, being an endocrine disruptor, actually affected thyroid hormone secretion. And this led to potentiation or induction of a particular protein, an enzyme called Musashi-1. And this Musashi-1 enzyme was what actually was the factor that babies that were exposed, whether intrauterine or otherwise, to this particular agent were therefore predisposed or at high susceptibility to the effects of Zika virus because it potentiated replication of the virus. Now, there's another perhaps the second most widely used pesticide worldwide, and certainly in the United States, is atrazine. Many of these names we are not familiar with in the medical fraternity. And, perhaps the most well-known outspoken scientist and researcher of this particular issue is Dr. Tyrone Hayes. He's coming out of the United States, who initially did the seminal work on atrazine and observed that atrazine was associated with feminization in frogs, and then subsequently began to look at the effects in other vertebrate classes and realized the same effects, where literally the behavior of these animals were changing from the typical male pattern behavior to female pattern behavior. And you were seeing, even in the case of frogs, where literally male frogs were now producing eggs and taking on true hermaphrodite phenotypic appearances. So, and these were seen at levels that were even consistent with what was being found in the drinking water in some areas. And the reason for this is because atrazine also is an endocrine disruptor, and it potentiates the enzyme aromatase, which is responsible for the conversion of testosterone to estrogen. And so consequently, persons exposed to atrazine are having higher activity of aromatase, and literally their innate testosterone is being converted to estrogen. And so you can see in male individuals, you can see where now that is going to lead to a lower testosterone. High levels of estrogen, of course, will be associated with obesity. It will also be associated with higher risk of diabetes. There's also, because of lowered effects of testosterone, there's reduced sperm production and then consequently reduced fertility. So, and then of course, there have been other associations, not just with the challenges with reproduction, but even for women who have been exposed, who have gotten pregnant, malformations such as gastroschisis and choanal Now, glycophosphate is perhaps one of the most, if not the most widely used pesticide. Most of us will know this as Roundup. I mean, I've used Roundup in my garden back in the day. And Roundup was so unique in that it killed effectively the weeds without destroying the actual plant that you wanted to preserve. So if you had a lawn, it will kill the weeds and it will preserve the grass. And it was such a unique thing until we realized that there were significant problems with Roundup. The glyphosate from Roundup was actually causing issues, binding, spending a lot more time in the environment than we previously thought, and has been shown to be spermatotoxic by a number of different studies. Then we have to look at the home and industrial settings where we have pollutants. Most of us in the medical field would have remembered diethylstilbestrol, which was marketed in the 70s as a treatment for reducing the risk of miscarriage. And of course, was found later to be associated with a myriad of issues in the offspring of women who used it, including malformations of the genital tract, increased risk of certain cancers, preterm delivery, miscarriages, etc. And so the diethylstilbestrol was banned, and in most countries it's banned and it's not used anymore. Now, we'd have thought that was the end of it, but one of the things that we have observed is that the molecular structure of many of the chemicals that we interact with today on a daily basis is actually quite similar to that of diethylstilbestrol. So, for example, bisphenol A, or BPAs, we see commonly in plastic containers, you know, the nice Tupperware containers that we use to carry our food around or store them in the fridge, yes, or even on the inner lining of some of the canned goods that we have. So it's healthy to have beans and so forth, but then the inner lining of the contains an acrylic type epoxy material which contains BPA. And then perhaps even more significantly, phthalates, which are pretty much ubiquitous in everything from toys to makeup to perfumes in particular. Phthalates are quite popular. In fact, I was surprised to find out that phthalates are responsible for that nice new car smell. You know, every time you go into a new car and you have that nice new car smell, then, you know, you're actually inhaling phthalates, you know. And phthalates are particularly important because they are also endocrine disruptors, okay? And they are, because of the estrogen-like molecular structure, they actually are counteractive to testosterone. So for males, they reduce the sperm production, they reduce fertility, they're associated with obesity and diabetes, and also behavioral problems. In women, similarly, it's associated with an increased risk of obesity and insulin resistance. And we know that that is also, those two are precursors for polycystic ovary syndrome, ovulatory dysfunction, and therefore reduced fertility, diabetes as well.
Dr. Campbell, we're running out of time. We're a little constrained for time. How much more time do you need?
All right, well, I'm wrapping up now. So the last thing so I'll mention dioxins, which are also widely produced from most activities that we do industrially. They are also endocrine disruptors. And then finally, we talk about microplastics, for which we have increasing evidence. We understand that plastics don't break down, they just get smaller and smaller. And microplastics have recently been found in human tissue as well as placenta. And so much food for thought here, and I'll stop at this point and open up the floor for any questions.
Your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. One more time now. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. Listen up. Love your body, treat your body right. Love your body, treat your body right. One, two, three, two more. 1, 2. Adults to 30 minutes activity daily. Love your body, treat your body right. Vegetables, make sure you eat plenty. Children do 60 minutes activity daily. Drink some water when you feel thirsty. Cut down dessert and have a smoothie. Jamaicans, love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. One more time now. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. Listen up. Make sure you know your health status. Go a doctor and get a regular checkup. Chronic disease can slowly creep up. We can lower the risk and live up if we just eat right and get moving. Jumping, running, dancing or skipping. Change the children, them lazy habit. Make them play out the door and put down the tablet. Jamaicans, love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Your body right, your body right. After 2, make me hear you say I love me. 1, 2. I love me. 1, 2. I love me. 1, 2. I love me. Jamaicans, love your body, treat your body right. Love your body, treat your body right.
My mama told me I need to come off the tablet. Yes, you should. We need physical activity. Well, that's what adults say. Adults, I tell you. Seriously though, with physical activity, we will get better grades, better heart health, and improve the bone health. Oh, I heard it will improve memory and overall mood. Yes, it will maintain our weight and lowers the risk for depression. Do you know what will lower your self-depression? What?
During this time, with online schooling, we are sitting for too long. The problem with sitting for too long is that it leads to soreness, aches, and pains throughout our body.
We're gonna get funky, 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 funky. Everybody clap your hands. Clap, 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 clap your hands. Clap, 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 clap your hands. All right, now, we're gonna do the basic step. To the left. Take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha, real smooth. Turn it out. To the left. Take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha now, y'all. Now it's time to get funky. To the right now. To the left. Take it back now, y'all. One hop this time. One hop this time. Right foot, two stumps. Left foot, two stumps. Slide to the left. Slide to the right. Crisscross. Crisscross. Cha-cha, real smooth. Let's go to work. To the left. Take it back now, y'all. Two hops this time. Two hops this time. Right foot, two stumps. Left foot, two stumps. Hands on your knees, hands on your knees. Get funky with it. Oh, yeah. Come on. Cha-cha now, y'all. Turn it out. To the left. Take it back now, y'all. Five hops this time. Right foot, let's stomp. Left foot, let's stomp. Right foot again. Left foot again. Right foot, let's stomp.
Is your wealth, so come we start the conversation. Make we rise and immunize all across the nation. The ministry is giving us the motivation to get your infants routine immunization. Protect the toddlers from all diseases. Tetanus, rubella, whooping cough and the measles. Polymyelitis, mumps and the flu, plus tuberculosis to name a few.
Rise to immunize. Eliminating diseases saves lives. Visit your nearest clinic or health center for more information or log on to www.moh.gov.jm. A message from the Ministry of Health and Wellness.
The Ministry of Health and Wellness is celebrating Caribbean Wellness Day 2023 with a weekend of wellness. Saturday, September 9th, all roads lead to the University of Technology Jamaica for a sweat fest. 4 p.m. to 8 p.m. Join the 3K Fun Run Walk, pass through the obstacle course, and work up a sweat with the Sweet Energy Fitness team. Admission free. No sign-up required. Lots of prizes and surprises along with free food samples. Come, get it Jamaica Moves shirt. It's a weekend of wellness. Wow, with the Ministry of Health and Wellness.
like you out to mash up some spraying idea.
Yeah, I go spray them corner.
So, are the three wearing the protective gear?
Boy, the sun too hot for suit up here, man.
So you did read the label before you start. Wear protective gears. Your goggles, your respirator, your gloves, and a coverall. At least you did have on a cap. Mix only what you need for the day. Use only on the crops listed, and if some chemical left over, make sure you store it in the original container.
For more information, call the Pesticides Control Authority at 754-9306.
Any food safety incident is one too many. It affects the health of consumers, it affects food trade and everyone involved, from the farmer to the retailer. The Codex Alimentarius is an important building block of having a safer food supply. But everyone involved in the food chain has a role to play to make sure that the food we eat is safe. Codex, FAO and WHO are supporting the establishment of a World Food Safety Day to bring greater attention to this important issue. Join our campaign in supporting annual observance of this important event. All you have to do is send us a video or an image to show your support for this important event.
My mama told me I need to come off the tablet. Yes, you should. We need physical activity. Well, that's what adults say. Adults, I tell you. Seriously though, with physical activity, we will get better grades, better heart health, and improve the bone health.
Oh, I heard it will improve memory and overall mood.
Yes, it will maintain our weight and lower the risk for depression.
Do you know what will lower your risk of depression?
What?
During this time, with online schooling, we are sitting for too long. The problem with sitting for too long is that it leads to soreness, aches, and pains throughout our body.
We're gonna get funky. 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 Everybody clap your hands. Clap. clap, clap, clap your hands. Clap, 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 clap your hands. All right, now, we're going to do the basic step. To the left. Take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha, real smooth. Turn it out. To the left. Take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha now, y'all. Now it's time to get funky. To the right now. To the left. Take it back now, y'all. One hop this time. One hop this time. Right foot, 2 stumps. Left foot, 2 stumps. Slide to the left. Slide to the right. Crisscross. Crisscross. Cha-cha, real smooth. Let's go to work. To the left. Take it back now, y'all. 2 hops this time. 2 hops this time. Right foot, 2 stumps. Left foot, 2 stumps. Hands on your knees, hands on your knees. Get funky with it. Oh, yeah. Come on. Cha-cha now, y'all. Turn it out. To the left. Take it back now, y'all. 5 hops this time. Right foot, let's stomp. Left foot, let's stomp. Right foot again. Left foot again. Right foot, let's stomp.
Your health is your wealth, so come we start the conversation. Make we rise and immunize all across the nation. The ministry is giving us the motivation to get your infants routine immunization. Protect the toddlers from all diseases. Tetanus, rubella, whooping cough and the measles. Polymyelitis, mumps and the flu, plus tuberculosis, to name a few.
Rise to immunize. Eliminating diseases saves lives. Visit your nearest clinic or health center for more information or log on to www.moh.gov.jm. A message from the Ministry of Health and Wellness.
The Ministry of Health and Wellness is celebrating Caribbean Wellness Day 2023 with a weekend of wellness. Saturday, September 9. All roads lead to the University of Technology, Jamaica for a sweat fest. 4 p.m. to 8 p.m. Join the 3K Fun Run Walk. Pass through the obstacle course and work up a sweat with the Sweet Energy Fitness team. Admission for free. No sign-up required. Lots of prizes and surprises along with free food samples. Come, get your Jamaica Moves shirt. It's a weekend of wellness. Wow, with the Ministry of Health and Wellness.
I came out to mash up some spraying idea.
Yeah, I go spray them corn there.
So, are the 3 way in the protective gears?
Why the sun too hot for suit up here, man?
So you read the label before you start. Wear protective gears. Your goggles, your respirator, your gloves, and a coverall. At least you did have on a cap. Mix only what you need for the day. Use only on the crops listed, and if some chemical left over, make sure you store it in the original container.
For more information, call the Pesticides Control Authority at 754-9306.
Any food safety incident is one too many. It affects the health of consumers, it affects food trade and everyone involved, from the farmer to the retailer. The Codex Alimentarius is an important building block of having a safer food supply. But everyone involved in the food chain has a role to play to make sure that the food we eat is safe. Codex, FAO and WHO are supporting the establishment of a World Food Safety Day to bring greater attention to this important issue. Join our campaign in supporting annual observance of this important event. All you have to do is send us a video or an image to show your support for this important event.
My mama told me I need to come off the tablet. Yes, you should. We need physical activity. Well, that's what adults say. Adults, I tell you. Seriously though, with physical activity, we will get better grades, better heart health, and improve the bone health. Oh, I heard it will improve memory and overall mood. Yes, it will maintain our weight and lowers the risk for the pressure. Do you know what will lower your self-depression? What?
During this time, with online schooling, we are sitting for too long. The problem with sitting for too long is that it leads to soreness, aches, and pains throughout our body.
We're gonna get funky, 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 funky. Everybody clap your hands. Clap, 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 clap your hands. Clap, 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 clap your hands. All right, now, we're gonna do the basic step. To the left, take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha, real smooth. Turn it out. To the left, Take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha now, y'all. Now it's time to get funky. To the right now. To the left. Take it back now, y'all. One hop this time. One hop this time. Right foot, 2 stumps. Left foot, 2 stumps. Slide to the left. Slide to the right. Crisscross. Crisscross. Cha-cha real smooth. Let's go to work. To the left. Take it back now, y'all. 2 hops this time. 2 hops this time. Right foot, 2 stumps. Left foot, 2 stumps. Hands on your knees. Hands on your knees. Get funky with it. Oh, yeah. Come on. Cha-cha now, y'all. Turn it out. To the left. Take it back now, y'all. 5 hops this time. Right foot, let's stomp. Left foot, let's stomp. Right foot again. Left foot again. Right foot, let's stomp.
Is your wealth, so come we start the conversation. Make we rise and immunize all across the nation. The ministry is giving us the motivation to get your infants routine immunization. Protect the toddlers from all diseases. Tetanus, rubella, whooping cough and the measles. Polymyelitis, mumps and the flu, plus tuberculosis to name a few.
Rise to immunize. Eliminating diseases saves lives. Visit your nearest clinic or health center for more information or log on to www.moh.gov.jm. A message from the Ministry of Health and Wellness.
The Ministry of Health and Wellness is celebrating Caribbean Wellness Day 2023 with a weekend of wellness. Saturday, September 9. All roads lead to the University of Technology, Jamaica for a sweat fest. 4 p.m. to 8 p.m. Join the 3K Fun Run Walk. Pass through the obstacle course and work up a sweat with the Sweet Energy Fitness team up. Admission for real. No sign-up required. Lots of prizes and surprises along with free food samples. Come, get your Jamaica Moves shirt. It's a weekend of wellness. Wow, with the Ministry of Health and Wellness.
Like you out to mash up some spraying idea.
Yeah, I go spray them corn there.
So, are the 3 wearing the protective gear?
Why the sun too hot for suit up here, man?
So you did read the label before you start? Wear protective gears. Your goggles, your respirator, your gloves, and a coverall. At least you did have on a cap. Mix only what you need for the day. Use only on crops listed. And if some chemical left over, make sure you store it in the original container.
For more information, call the Pesticides Control Authority at 754-9306.
food safety incident is one too many. It affects the health of consumers, it affects food trade and everyone involved, from the farmer to the retailer. The Codex Alimentarius is an important building block of having a safer food supply. But everyone involved in the food chain has a role to play to make sure that the food we eat is safe. Codex, FAO and WHO are supporting the establishment of a World Food Safety Day to bring greater attention to this important issue. Join our campaign in supporting annual observance of this important event. All you have to do is send us a video or an image to show your support for this important event.
My mama told me I need to come off the tablet. Yes, you should. We need physical activity. Well, that's what adults say. Adults, I tell you. Seriously though, with physical activity, we will get better grades, better heart health, and improve the bone health. Oh, I heard it will improve memory and overall mood. Yes, it will maintain our weight and lowers the risk for the pressure. Do you know what will lower your risk of depression? What?
During this time, with online schooling, we are sitting for too long. The problem with sitting for too long is that it leads to soreness, aches, and pains throughout our body.
We're gonna get funky, 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 funky. Everybody clap your hands. Clap, 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 clap your hands. Clap, 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 clap your hands. All right, now, we're gonna do the basic step. To the left. Take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha, real smooth. Turn it out. To the left. Take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha now, y'all. Now it's time to get funky. To the right now. To the left. Take it back now, y'all. One hop this time. One hop this time. Right foot, 2 stumps. Left foot, 2 stumps. Slide to the left. Slide to the right. Crisscross. Crisscross. Cha-cha, real smooth. Let's go to work. To the left. Take it back now, y'all. 2 hops this time. 2 hops this time. Right foot, 2 stumps. Left foot, 2 stumps. Hands on your knees, hands on your knees. Get funky with it. Oh, yeah. Come on. Cha-cha now, y'all. Turn it out. To the left. Take it back now, y'all. 5 hops this time. Right foot, let's stomp. Left foot, let's stomp. Right foot again. Left foot again. Right foot, let's stomp.
Your health is your wealth, so come we start the conversation. Make we rise and immunize all across the nation. The ministry is giving us the motivation to get your infants routine immunization. Protect the toddlers from all diseases. Tetanus, rubella, whooping cough and the measles. Polymyelitis, mumps and the flu, plus tuberculosis, to name a few.
Rise to immunize. Eliminating diseases saves lives. Visit your nearest clinic or health center for more information or log on to www.moh.gov.jm. A message from the Ministry of Health and Wellness.
The Ministry of Health and Wellness is celebrating Caribbean Wellness Day 2023 with a wow, a weekend of wellness. Saturday, September 9. All roads lead to the University of Technology, Jamaica for a sweat fest. 4 p.m. to 8 p.m. Join the 3K Fun Run Walk. Pass through the obstacle course and work up a sweat with the Sweet Energy Fitness team. Admission for real. No sign-up required. Lots of prizes and surprises along with free food samples. Come, get your Jamaica Moves shirt. It's a weekend of wellness. Wow, with the Ministry of Health and Wellness.
Can you mash up some spraying idea?
Yeah, I go spray them corn there.
So, are the 3 wearing the protective gear?
Why the sun too hot for suit up here, man?
So you read the label before you start. Wear protective gears. Your goggles, your respirator, your gloves, and a coverall. At least you did have on a cap. Mix only what you need for the day. Use only on the crops listed. And if some chemical left over, make sure you store it in the original container.
For more information, call the Pesticides Control Authority at 754-9306.
Any food safety incident is one too many. It affects the health of consumers, it affects food trade and everyone involved, from the farmer to the retailer. The Codex Alimentarius is an important building block of having a safer food supply. But everyone involved in the food chain has a role to play to make sure that the food we eat is safe. Codex, FAO and WHO are supporting the establishment of a World Food Safety Day to bring greater attention to this important issue. Join our campaign in supporting annual observance of this important event. All you have to do is send us a video or an image to show your support for this important event.
My mama told me I need to come off the tablets. Yes, you should. We need physical activity. Well, that's what adults say. Adults, I tell you. Seriously though, with physical activity, we will get better grades, better heart health, and improve the bone health. Oh, I heard it will improve memory and overall mood. Yes, it will maintain our weight and lowers the risk for the pressure. Do you know what will lower your self-depression? What?
During this time, with online schooling, we are sitting for too long. The problem with sitting for too long is that it leads to soreness, aches, and pains throughout our body.
We're gonna get funky. 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 Everybody clap your hands. Clap, 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 clap your hands. Clap, 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 clap your hands. All right, now, we're gonna do the basic step. To the left. Take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha, real smooth. Turn it out. To the left. Take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha now, y'all. Now it's time to get funky. To the right now. To the left. Take it back now, y'all. One hop this time. One hop this time. Right foot, 2 stumps. Left foot, 2 stumps. Slide to the left. Slide to the right. Crisscross. Crisscross. Cha-cha, real smooth. Let's go to work. To the left. Take it back now, y'all. 2 hops this time. 2 hops this time. Right foot, 2 stumps. Left foot, 2 stumps. Hands on your knees, hands on your knees. Get funky with it. Oh, yeah. Come on. Cha-cha now, y'all. Turn it out. To the left. Take it back now, y'all. 5 hops this time. Right foot, let's stomp. Left foot, let's stomp. Right foot again. Left foot again. Right foot, let's stomp.
Good afternoon, everyone. Welcome back to the afternoon session of the 14th National Health Research Conference. Now we move into conference fun and giveaway. We just enjoyed our breakout sessions. We had a breakout session from Rado. We had a breakout session from Mr. Siva Davidson for communication for researchers. We had a breakout session for healthy eating and you from the nutrition unit. And we had a reasoning on the wellness bench with the mental health unit. So I hope you enjoyed those sessions. And now we're moving to another fun segment, which is conference fun and giveaway. If you will recall, on Wednesday, we had 4 questions, and I'm happy to announce that we have 2 winners. We have a winner for question 1 and for question 4, but we did not have a winner for question 3 and for question 2. I will be repeating question 2 today, so let's listen out for these questions, and remember, please text your answer to 344 3204. You're going to text your answer to 344-3204. So question number 1. How many oral presentations did we have for NHRC 2023? How many oral presentations did we have for NHRC 2023? That's question number 1. Question number 2. How many panel discussions are we having for NHRC 2023? How many panel discussions are we having for NHRC 2023? So this question was given out on Wednesday. We did not receive a correct answer. So this question is still open to be won. So question number 2 is, how many panel discussions are we having for NHRC 2023? And now, question number 3, please give the name and title of the feature presenter for presentation number 2. Please give the name and title of the feature presenter for feature presentation number 2. And that was on Wednesday evening. And so I'd like you to give the name of the presentation and the name of our presenter. So the title of their presentation and the name of our presenter. So that's question number 3. And our final question for conference fund and giveaway: how many poster presenters did we have for NHRC 2023? Of course, we've been encouraging you guys to look in the poster hall. So how many poster presenters do we have for NHRC 2023? So remember, ladies and gentlemen, please text, do not put it in the chat, please text your answer to 344-3204. And in terms of collecting the prizes, we will indicate that, but of course you will collect the prizes following the close of the conference at the Ministry of Health's head office. All right, so those were the questions for conference fund and giveaway. We're looking forward to receiving those answers. Thank you. So now we take a break and we'll move into our final panel discussion for the conference, which is telemedicine and ethics. So we'll be right back.
Okay. Welcome to the final feature presentation session of the 14th Annual National Health Research Conference, where we'll be looking at telemedicine and ethics. Thank you for joining us, and thank you for all of you all who have stayed the course on this rainy day. We have a diverse panel of experts to share with us today on the matter of telemedicine and ethics. And it is really opportune because, as you know, the COVID-19 pandemic taught us many things. And one of, should I say, the better things would be the importance of telemedicine during such situations. However, we have to be mindful that there are ethical considerations, such as patient privacy, confidentiality, data protection and security, physician liability. So our esteemed panelists, we have Professor Jennifer Knight-Madden, who is the chair of the Advisory Panel on Ethics and Medical Legal Affairs at the Ministry of Health and Wellness. We have Mr. David Gray, JP, who is the Deputy Information Commissioner in the Office of the Information Commissioner. And we have Dr. Chair Bowen, who is the Chief Executive Officer for MD Link. Now, how this session will go is that they will present in that order, Prof. Knight-Madden, then Mr. Gray, then Dr. Bowen, and they will come up unannounced. But initially, I will introduce them to you. I know that this will be an insightful discussion. So Professor Jennifer Knight-Madden is the former director of the Sickle Cell Unit at the Caribbean Institute for Health Research, the University of the West Indies, and she continues to be a part of the Sickle Cell Organization in the Caribbean and Africa. Her research interests include the pulmonary complications of sickle cell disease, implementation science, and health services research. She has published more than 60 peer-reviewed articles and several book chapters. Prof. Knight-Madden currently chairs the Advisory Panel on Ethics and Medical Legal Affairs at the Ministry of Health and Wellness. Professor Knight-Madden is married and has 2 daughters. She serves on the PTA Executive and Board of Management of the St. Andrew High School for Girls. Mr. David Gray, JP, serves as the Deputy Information Commissioner at the Office of the Information Commissioner and is a qualified attorney at law with a remarkable 36 years of experience in the public sector. He has contributed his expertise to various government agencies. He's a certified fraud examiner and holds a postgraduate degree in business from Manchester University. Mr. Gray is the secretary for the board of the Quality Network Limited. He serves as chairman of the Jamaica Credit Union Pension Fund Limited, and sits on the board of St. Mary High School, his alma mater. Dr. Chair Bowen is an innovative and entrepreneurial medical professional with over a decade of experience in the medical field. Dr. Bowen has been a trailblazer in providing convenient, affordable health care to patients across the Caribbean. He launched MD Link in 2018 and currently serves as the CEO and Chief Medical Officer. MD Link serves its patients virtually and has revolutionized access to healthcare services in Jamaica and 8 other countries. Through the development of the MD Link platform, Dr. Bowen has altered the healthcare landscape in the Caribbean to be more inclusive and readily accessible. The necessity of the services offered by MD Link was highlighted during the COVID-19 pandemic. Dr. Bowen is committed to finding dynamic ways of changing the way we in the Caribbean understand and experience health care. Please, ladies and gentlemen, help me to welcome Professor Jennifer Knight-Madden to the podium.
Good afternoon. Hope you're hearing me well.
Please excuse me that I cannot use the podium because being vertically challenged. There we go. I can see now. All right, next slide. Oh, actually, before you go, I think I was invited as the chair of the advisory panel on ethics and medical legal affairs. Turns out I'm also a member of the Standards, Bureau of Standards Jamaica Medical Facilities Technical Committee, which wrote standards for telehealth. And of course, I work at the sickle cell unit. So as I'm going first, I thought I would start with some definitions and then look at the current situation from the point of view of the standards, ethics, research, because we've also published on telehealth, what is happening clinically and in terms of privacy, which my colleagues will go into in more detail. So these are very wordy, but these are actually quoted from the Bureau of Standards in terms of the differences between telehealth and telemedicine. And basically, telemedicine is a part of telehealth. So everything that is telemedicine is included in telehealth. But telehealth is broader. It includes anything that includes technology and health, even if it's not providing direct health care to patients. So, for example, the app you have on your phone that helps you to count calories, that's health-related, so it's telehealth. Or the Project Echo that we did in chronic disease recently to teach providers, that's also telehealth. And when we have our administrative group meetings of organizations such as the Sickle Cell Technical Working Group using Zoom, also telehealth, but not actually directly affecting patients and so on. So we all know about research ethics. This definition comes from the World Health Organization, and we know that the grounding principles are beneficence, which means you're doing good, justice, which means that everybody has an equal chance of being involved, and autonomy. You see what happens when you're not tall? But I want to say that even though the ethics committees and, Professor Trotman is also the chair of a committee, we deal with research. But that's not the only ethics that we're concerned with here today. We have to think about the general issue of ethics. And ethics are moral principles that govern or they decide our behavior. So even in the aspects of telehealth that are not research, ethics are still involved. And we still have to think about being good and not doing harm, justice, or allowing people to be autonomous and protecting them. So we know that telemedicine is going on in Jamaica, right? People are using video, phone, internet-based platforms, web chats, apps, web portals, all different kinds of things. But a lot of people are actually unaware that there's a standard. Let's see in the room, how many people knew that the Bureau of Standards Jamaica has a standard for telemedicine? Okay, one hand out of everybody here. So obviously, we have some experts up there, so they know. But clearly, as the Bureau of Standards, there needs to be more publicity about this. Now, the clinical use may not be as tightly regulated, but it should be based on ethics. But it also has to be based on laws. So, the Data Protection Act, which we'll hear about, Medical, Dental, Pharmacy Profession Supplementary to Medicine Act. So if the Pharmacy Act does not allow for online prescriptions, then you need to change the law to permit that. But all of what is happening should be in keeping with the existing laws of the country that it's being used in. So we also, at the Sickle Cell Unit, use some retrospective data to publish about telehealth during the COVID epidemic. But there's also research going on which is prospective, where they're trying to find out about ongoing use of telehealth, and that always has to go to the Research Ethics Committee. So this is just a picture of the front page of our standard, and I invite you to link with the Bureau of Standards and make sure that you are aware of that standard and all that is included in it. So the Bureau of Standards Jamaica, we would have done research about standards right around the world and use that to craft a standard that is appropriate to us. Now, in terms of the Advisory Panel for Ethics and Medical Legal Affairs, as we said, guiding principles, beneficence, justice, and autonomy. One of the main problems or issues we have to think about when we're doing online research, right, is informed consent. Because all the aspects of research ethics apply when you're doing online research. And consent is one of the most important aspects. Now, informed consent must include the fact that it is prospective, so you do it ahead of time. That the person has adequate information allowing for understanding. So we have to make sure that everything is written at a level that people can understand. They have to understand the risks and the benefits, and it has to be totally voluntary. People have to be able to refuse and to withdraw. But here's the thing. When you're writing anything for online, you have to somehow build in an opportunity to ask questions and clarify anything that is unclear. It cannot be, okay, here's our information, click on this and go straight to the questionnaire without allowing for that stage where you can say, I don't understand this, I want to know more about this, this must be built into the research proposal. What also becomes a little complex is the signing of this consent form. How do you know that the person on the other end of this computer or phone is actually a person that is supposed to sign? Suppose it's a parent signing for a child. Are you sure that it's a parent signing and not the child? So you ideally would build some kind of mechanism in to ensure that the person who is signing on the other end, as much as is possible, is the person who is supposed to give consent for this process. So some of the research that has been done in Jamaica on telehealth was actually done at the sickle cell unit. This was led by Dr. King. And you'll see that several of our younger doctors and nurses are involved in this process. And what we did was look at telehealth at the sickle cell unit during the pandemic. Now, ours was very low tech. We use a phone. But what we found is looking at a 3-year period, a year before and 2 years during the pandemic, we looked at trends. As many as 31% of our visits were telehealth visits. More adults came in, less children came in, and that's in keeping with what other people have seen. And we also saw some patients we hadn't seen for years. They turned up when they heard that they had the option of using a phone. So it's important in terms of research, but it's also important in terms of clinical reach. Sometimes you have patients that cannot, for whatever reason, come in, and you want to be able to reach them with services. So it may vary from as simple as a telephone call to complex purpose-built systems. You'll hear about one in a little while that can include voice, video, documents, images, appointment systems, billing, and all sorts of bells and whistles. But it's clearly topical because this morning's Observer had an article in the business section about telehealth. And they spoke to a company called 19 Lab, which is in Guyana, which they said is now in talks with the government here for reaching distant places. And that same article also spoke to a project launched about 5 years ago in Kingston town by the ministry and the university hospital. So there's clearly a need to bring specialists that might not be available to people out there without them having to come in. But it has to be done under the arching cover of ethics. Whether it's research or not, ethics has to drive what we do. So we'll hear more about the Jamaica Protection Act 2020. We have to stay within what is prescribed there. Thank you. So I hope I've given you an overview into which you can now add with my two colleagues. Thank you.
Good afternoon, everyone. I want to thank you on behalf of our office, the Office of the Information Commissioner, for having invited us to this session on telemedicine. And I hope you find the presentation useful. By way of opener, Dr. Knight Madden gave you in one of her last slides the Data Protection Act. And the Data Protection Act, which is Act number 7 of 2020, was signed into law by the Governor General July 10th, 2020. After that occurred, on December the 1st, 2021, Honorable Minister then Daryl Vaz brought into operation certain sections of the Act, which more or less set the foundation to create the office. And arising from that, the Office of the Information Commissioner was established. The Data Protection Oversight Committee was also established and appointed, and Jamaica's first Information Commissioner was appointed. Now, moving straight into what does the Data Protection Act seek to do? It protects data and protects data privacy and protection, which is its two principal objectives. And what is personal data? Given the vast majority of you are in the health practitioner area, it is information from which a person, living or deceased, that is less than 30 years, can be identified. There are certain common identifiers when looking at personal data: name, addresses, telephone numbers, contact numbers, alias names. If you have a scar on your face that is prominent enough that it becomes a major feature of you, it is also a part of a common identifier. Then, of course, you have genetic data, biometric data, and what is referred to as sensitive personal information. For healthcare practitioners, sensitive personal information covers such topics as sexual orientation, race, ethnicity, religion, biological relationship, mental health, membership and association in any trade union, criminal allegations or proceedings, philosophical beliefs, genetic or biometric data, but of course, most importantly, your health care information. Critical terms that all persons who are engaged in telemedicine, as well as all of us in society, will need to know is a data subject, you and I. It's a named or otherwise identifiable individual who is the subject of personal data. You have a data controller, who is any person or public authority who either alone or jointly or in common with other persons determines the purposes for which and the manner in which personal data are to be processed. Telemedicine providers as well as medical providers are data controllers. You have a data protection officer, which is a unique feature of this legislation, which is an appropriately qualified person appointed by a data controller who shall be responsible for monitoring in an independent manner the data controller's compliance with the Data Protection Act. So this is an independent person employed by the data controller who monitors the operations, will address the questions, complaints that data subjects may bring forward. Critically, as I will tell you before, the data protection officer, the concern under the Act is that that person must not be in any conflict of interest. So the position that they hold as data protection officer must not conflict with any other duty that they undertake. Then you have a data processor, which is any other person than the data controller who processes the data on behalf of the data controller. Another definition which you may need to know, which is core, is processing, which is obtaining, recording, storing the information or personal data, or carrying out any operation or set of operations, whether or not by automated means. And of course, lastly, personal data, which is any information in the possession of a data controller relating to an identified or identifiable individual who has been deceased less than 30 years. Now, overarching all of these core terms, and this, as I told you before, Data Protection Act seems to protect both the privacy rights and protect the processing of data. The rights that are to be protected, a data subject has that will be protected, is that the data subject has a right to access and to be informed of the data that the data controller has in their possession. You also have the data subject has a right to prevent processing. So as Dr. Knight mentioned before, in relation to someone agreeing to be placed on a telemedicine platform, they also have the right to stop. They also have a right to object to decisions made solely on the basis of automated processing. So where it is, if in your telemedicine, you go ahead and link it, Dr. Bowen, to like AI, and the AI does the diagnostic work, and the client data subject is aware that AI is actually doing all the diagnostic, they have the right to say, no, I want a human interface. Of course, you have a right to rectification. Simply put, that's just a right to correct any errors in the data. And of course, you have a right to give and to withdraw your consent freely. Right? So you sign in and you can sign out, or opt in or opt out, which is the more elegant term used. I will plead my ignorance. I didn't go to delve into Bureau standards to see that there was actually a standard. So I went to the American Telemedicine Association, which is pretty close to the standard, which refers to the provision of healthcare services remotely using information and communication technologies. It involves the exchange of medical information from one side to another through electronic communication to improve a person's health status. And it encompasses various forms of communication: video calls, phone consultations, remote monitoring, and digital health apps. The most prevalent one that my doctor uses is Zoom. Right? And what are the key aspects of telemedicine? Consultations. Patients consulting with their healthcare provider via video calls, phone calls, which of course during COVID times eliminated the need for us to actually be in the office. Those of us who were extremely fearful of what may occur. Of course, you also have remote monitoring. Patients' vital signs and health parameters can be monitored remotely using wearable devices or other digital health tools. So, you know, our blood pressure machines that we all hook up to ourselves and we show the doctor the screen so that he can see it for himself. Digital health apps, apps allowing patients to manage their health schedule appointments and communicate with healthcare providers through secure platforms. We also have specialist consultations, which allows us access to specialists who may not be physically present in a patient's location. And of course, health education, where we use telemedicine to provide educational resources and information to patients. So how does data protection interlink with telemedicine? Data protection is critical due to the sensitive nature of health information. Patient data, medical records, and personal details is transmitted and stored electronically, raising concerns about privacy, security, and compliance with data protection laws. So important is it that the Act specifies sensitive personal data, which includes all patient medical records. And in so doing, it also created what may be another issue for practitioners, is that all persons who handle sensitive personal data will have to have a data protection officer in place. So that is how serious the Act looks at sensitive data, and of course sensitive data which intersects now with telemedicine. So what are the common data protection principles that apply when dealing with telemedicine? We look at the concept of informed consent. The providers should obtain explicit and informed consent from patients before collecting, processing, and sharing their health information. Patients, in addition to the patients, must understand what they are being or authorizing prior to coming in. And the language should be as simple as possible so that when a person is giving their consent, they know exactly what they're consenting to. The patients, of course, need to be aware of how their data will be used and how it will be protected. Another common and most important principle, and as I mentioned before, the whole ethos of the Act is dealing with data privacy and protection, is in how the data is going to be managed. Data encryption, meaning that there must be some secure channel and encryption methods employed to protect the confidentiality and integrity of the patient data during the transmission. And the transmission is in relation to both the doctor-patient interface and whatever else may flow from that. So, of course, one is going to expect that if you're using a Zoom platform, you are going to set up as much of the confidentiality protocols that you can so that someone cannot intrude. The code would be unique to that patient when they set up the appointment so that no one else has access to that code. Okay? Because what we don't want is any unauthorized access or interception of the critical data that forms a part of that dialogue. What about access control? Strict access controls should be implemented to ensure that only authorized healthcare professionals have access to patient records. And we go through this very, very important. Access control is we need to know that the medical practitioner is interfacing with the patient of record. We don't want a situation where someone is logging in, telling some situations, the doctor is diagnosing, issuing the prescription, and it is not the applicable patient. So in most of these cases, of course, you know, when we use the Zoom platform, half of us turn off our cameras. I would highly recommend for the medical practitioner, their camera has to be on. And ideally, just as we expect our doctors to be in their office or in a confidential area, we would be recommending to the patient likewise. Because what you are about to disclose to us is confidential information which under normal circumstances is restricted to the office of the practitioner. Right? So we want to ensure that there are no data breaches and that we protect the patient's privacy. Now, data breaches are very, very a big thing when it comes to the Data Protection Act. And if a data breach occurs, and a data breach is where you have unauthorized access, to the platform, and unauthorized access to what may be regarded as patient's private information, once that is identified, the data controller has 72 hours to report that occurrence to the Office of the Information Commissioner. So it is very, very important that in setting up a telemedicine platform, the whole matter of confidentiality, privacy, encryption, authentication is inbuilt, not only to protect the patient, but to protect the medical practitioner. Another very important principle, which applies to telemedicine, of course, and this is something I will admit, maybe doctors will say, how minimum is minimum. But of course, one of the core tenets is data minimization, which is you only take the applicable information that you need. So in the course of a medical examination, the doctors generally ask targeted and pointed questions. They don't really go all around the world, as we would say, to do a diagnosis. So that conforms to the principle of the Data Protection Act, to take the applicable information you need, and that this information is stored. And of course, in storing it, you're storing it in some confidential and secure platform. I know a lot of the practitioners now are using computerized applications that their patient information is uploaded into. So they'll want to make certain that the interface with possibly internet hacking is minimized. So ideally, some persons go to the very extreme that the patient records database is not accessible via an internet, just to ensure that no one can just hack in. And if that isn't done, then they have as much encryption and security measures inbuilt, and they are constantly updated to ensure no unauthorized access. So with telemedicine, is the information protected? And the Data Protection Act provides the legal framework for the protection of personal data, which includes, as I mentioned before, health-related information during telemedicine consultations. What are the obligations that the data controller, which is the telemedicine provider, will have to ensure? They have to ensure that under the Act, they ensure the lawful process and fair processing of data. They must put in measures to implement, to protect the data subject rights. What are these rights? There are actually 8 of them. They're not on the slides, but I'll tell you them. Wrap up. Whatever information that is being collected must be done fairly and lawfully. must be done for the specified purpose. It must be adequate and relevant. It must be accurate. It must be kept for no longer than is necessary. It's processed in accordance with the rights of data subjects, and appropriate controls are in place to protect the data. Of course, with telemedicine and its interfacing with ethics, it must be transparent. What are your best practices? Regularly update your security protocols and technology to address evolving cyber threats. Provide ongoing training to healthcare professionals on data protection practices. And of course, conduct regular audits, which is IT audits, to assess and improve your data protection measures. As I mentioned before, all telemedicine practitioners, because they deal with sensitive personal data, will require a data protection officer. And of course, as mentioned previously, data protection officer shall not be qualified for appointment if there's any conflict of interest in any other duties that they may undertake. What do the data controllers have to do? Your obligations: register with the Information Commissioner, have to submit a data protection impact assessment, which is a framework setting out all the data. You're complying with the standards, reporting contraventions or breaches. Your requirements for registration are also noted. And what you will have to do now as a telemedicine provider, which is pretty critical, which intersects with what Dr. Madden mentioned before: modify documents, restrict, invest in cybersecurity software, liability, plan for liability, appoint a DPO, conduct a data protection impact assessment. Thank you.
All right, good day, everyone. My name is Dr. Che Bowen. I'm the founder and CEO of MD-Link, which is actually the first and largest telemedicine company, telemedicine platform in Jamaica and the Caribbean region. We launched back in 2018, and that was before the Bureau of Standards was even drafted and before the pandemic. And we have evolved into more of a telehealth company, not just a telemedicine company. And as was just explained, a telehealth company encompasses more than just telemedicine. Today I want to speak to you all about some of the practical things that MD-Link does in terms of telemedicine and ethics. First, I'm going to start by sharing some research or some data that has been harvested from the MD-Link platform. We noticed that 70% of the users are female. As we know, most of the healthcare decisions are made by the female in the household. 30% are male, and the age group of users is between 80 to 44. They're usually working class, have health insurance, and of course a smartphone. And some of the common conditions, they're common conditions and therefore they are large in number: urinary tract infections, STDs, erectile dysfunction. And right away you see the importance for data protection in telemedicine. How can telemedicine help Jamaica? How can it help the region? Some of the common things are increasing access to medical attention, making it more convenient, more affordable, no need to drive through the rain to get to your doctor. A lot of the doctor offices are closed today because of the rain, and that makes telehealth a perfect insert for healthcare in Jamaica right now. Where can we go? We can go to chronic care programs. The Ministry of Health is very determined to fight chronic care. Telemedicine is the answer. If you can integrate telehealth free to all the workers through Jamaica and put them into a chronic care program that's continuously monitoring them and their progress remotely, they're going to see progress. AI screening tools and triage tools. Again, during the pandemic, a lot of persons were actually jumping onto the platform to find out how to deal with the coronavirus. Who should we go to? Who should we call? Where should we go? Where is open? And AI can help with that. If you have the platform on your phone, you simply just go on, log on, and you can scroll through and get feedback on where you should go, where you can get tested, how you can get medical care. I think I came out, okay. And again, when we speak about telemedicine and ethics, some of the important considerations boil down to data protection, of course, continuity of care, identification, and emergency services. To elaborate on that, they have spoken a lot about the data protection aspect, but what about the ethics behind using Zoom or WhatsApp for telemedicine? There's no continuity of care, there's no storage of medical records, there's no data protection per se. So Zoom and WhatsApp, again, is not an ethical use of telemedicine. You want to have your backend and your patient data and your medical records. The patient should be able to go to another doctor and say, hey, I saw a doctor on my phone and this is what the doctor said. Can you help me any further? So that continuity of care you don't get with other video calling, phone calls. You don't get that unless you have a proper telemedicine platform. Emergency services. You don't want persons coming onto your platform with a broken leg or a heart attack, broken neck. They just got into a motor vehicular accident. You need to be able to triage those persons away from telemedicine. Immediately call 911, not telemedicine. That is not an implication or a use for telemedicine right now. In terms of data protection, it's something that MD-Link has been scared about from day one. Being the first to do it in the region, it was nerve-wracking, and you have to be very careful. What we did is, the first thing we did was appoint a data protection lawyer. So our data protection lawyer, Samantha Moore of Ramsey and Partners, she would have been guiding me, going through my platform, saying you need to change this, get your informed consent. And this is before the Data Protection Act even came about. We also were comparing to the Bureau of Standards. I was invited to be on that committee, and even American standards. MD-Link is up to that level in terms of data protection. Our backend is secure, it's hidden, it's encrypted, it's firewalled. You need 2 passwords to get into it. First you have to find it, then you have to log in, then you have to log in again. It's very secure. We have access controls for our users, meaning only specific confidentiality agreed employees can access certain information on the back end, certain parts of the patient data. And so we also have 2-factor authentication, Face ID, auto logouts. We're a very secure platform. Auto logouts means that if you log onto your phone and then your child grabs it up, you don't want them to go into your health app and pretend to be you, or order something that should not be, see something that should not be there, and therefore we have the auto logout system in place for that. There's even more in terms of data protection and telehealth. You want your employees to know that this is a serious situation. You sign them to confidentiality agreements. You train them so they know when they're speaking with patients, your care team speaking with patients, they know how to handle the information, how to speak with them, what to say, what not to say, where to guide them. You need your employees trained very well when it comes to operating online. Identification proves to be another important ethical consideration, especially when it comes to health insurance and insurance fraud. And therefore, what we do is we force our patients to upload a national identification. And not only that, we train our doctors when they enter the virtual appointment they confirm the date of birth with the patient. And in doing that, you get to confirm that this is actually the patient you're talking to before divulging any information or moving forward. We have implemented policies, procedures, and systems, again, under the guidance of our data protection lawyer. And we are in the process of fine-tuning everything to be ready for December 1 when the Data Protection Act drops. That's in a few days. All doctors need to be data protected. That's what I just found out. So you'll have a few days to get educated on data protection. It's coming at us hard, and we need to protect the patient's information. Thank you. I kept it short and sweet.
Okay, so we can all agree that this was indeed a very instructive session. We had Dr. Knight Madden first giving us the sort of ethical framework or guidelines for telemedicine. We had Mr. Gray, who gave us parameters in which we must operate based on the Data Protection Act and protection of data. And then we had Dr. Bowen, who gave us his real life experience. And I was very interested in that, and I have questions for him, but I will not take moderator privilege as yet. So just summing up for us, we see that there are benefits to telemedicine in terms of access to health, and we can see, remote areas, persons who may have disabilities, difficult terrain, etc. So we have that access to health. As Dr. Bowen pointed out, affordability, right? All of this builds into probably equity, if we increase equity to health. But there are some tensions, right? We note from an ethical point of view, patient privacy, confidentiality. From the Data Act protection point of view, that data protection and security, right? And one thing that Dr. Bowen didn't touch on as yet, and I'm going to ask him about, is that physician liability that comes in. First, though, I will open up the floor. Anyone who's here that may have any questions for our panelists? Okay.
That we are going into this aspect where we have a commissioner for information and somebody who is in charge of information, the officer. Now, if the officer is compromised, what will happen to the data? The one who is in charge of the data that is being pulled together. If the officer, one officer, is compromised, what will happen to the data? That is one question. Then another one is, when we as a nation, we are pushing to ensure that we're going into the space of telehealth and telemedicine, very interesting, very innovative, but are we really prepared for the real protection that the individual need as a nation. I'll stop there and get the response, and if I get enough, then I won't follow up. Thank you.
The first question that you asked, I'm not too clear on the aspect you're getting, because the office is a regulatory entity.
Okay.
So our remit is to protect all data subjects. We don't collect any data. All the data that resides in the hands of individuals, data controllers. And what we do is administer the tenets of the Act to how these persons handle the data.
Thank you. If that individual who is supposed to handle the data is compromised, the data controller, what happens?
The data controller is compromised, or is it the information commissioner? Which one? The data controller. That's where the data protection officer comes in.
Then what happens to the data?
Once there is any, let me try and explain. The data protection officer is entrusted to monitor the data protection officer. By law, they are protected in their dealings with the data controller. If they identify a breach and the breach is not corrected, then their duty is to report it to the Office of the Information Commissioner, and the Commissioner will levy the powers under the Act. The powers under the Act can include an onerous penalty of 4% of the worldwide income, which can be, if you use a multinational company, billions of dollars. In addition, if there is such a substantial breach, the Commissioner has the right to tell you to cease processing. So there are powers that are there, and if it is that the data controller is compromised in the handling of the data, once that is reported to us, there are provisions in the statute that we can utilize to address it. And that is why the data protection officer cannot be in any conflict with any other duty.
I think you are worried about the data subject and that their data has been compromised.
Again, the data subject, if their data has become compromised, as I mentioned before, once there's a breach, the data controller has 72 hours within which to notify the Information Commissioner of such a breach. And the consequences of that is, if no corrective action is immediately taken, as I mentioned before, the Commissioner can tell them to cease processing. So the process will require the reporting of the breach. The individual entity will have to take steps to ensure that the breach is cauterized, stopped. If that does not take place, then the powers that the Commissioner has under the Act will be utilized, and the most onerous can be fine, conviction, but the one that will be most problematic, particularly for a person who is practicing, is to cease processing. It means effectively stop. You can do nothing until the matter is corrected.
Thank you.
I have two questions. One, in terms of the data protection officer. For private practices, I guess they can hire somebody external, because the person can't have a conflict of interest, so you can't appoint a member of staff as your data protection officer, so you have to get somebody from outside. So what about, is it that the Ministry of Health then has to provide that service for everything under the ministry, the hospitals, the clinics, and so on? And the Ministry of, a little bit off topic, but the Ministry of Education Would they provide that service for all the schools?
All right, the act does not say that how the modality is to be introduced. But certainly for the larger ministries, they have been exploring whether to have an entire data protection unit headed by a data protection officer who will oversee the remit of the entire ministry. Some entities are appointing a data protection officer per entity. Now, the act is not set in stone to say every single clinic must have a data protection officer. What it will require, however, is that there be the broad power. If we take the University of the West Indies, they have one singular data protection officer appointed, but a unit of officers in there who will address any complaints. For large ministries, departments, and agencies, that might be the approach.
So my concern is smaller entities. So for example, if the Ministry of Health is covering the schools, what happens to the PTAs, the student councils, the other stakeholders that are processing data? Similarly, it may be small practices and so on. How do entities that don't turn over a lot of funds deal with this acquisition of a data protection officer?
That concern has been brought up, particularly by the Medical Doctors Association. And we sort of said to them that probably they could utilize getting an umbrella, a person, appoint a data protection officer for the Medical Association, and then the doctors might use that as a service. So it is, there will be a cost, but from where I sit, this is a requirement of the legislation, so it is a burden that will have to be approached.
I'm just sorry, just following on, but something just occurred to me. In terms of schools that have school nurses, they are collecting sensitive information. What happens there?
Well, remember, they fall under the broad auspices of the Ministry of Education. So the Ministry of Education would be, they're not doing a practice independently. They're actually providing a service through the school system, right? So the broad ministry will be the one that will be dealing with that.
Okay. Any more questions from the room?
Online question. Will all labs and other diagnostic agencies be required to adhere to the Data Protection Act as well?
Answer is yes.
And if there is a breach, is there also a duty to inform the person who the data was collected from that there was a breach, and if so, by what timeline?
If there is a breach, you have a duty to inform the data subject, that is the person whose information has been breached. Of course, you can see the logical reasons so that they can take whatever preventative steps that may happen. In the case of banking information, changing passwords, certainly when we're looking at telemedicine, they may have a unique password that allows them access to the telemedicine platform. So if there's a breach, you'll want to inform them so that they can take the steps to change those passwords, and also to call their doctors to say, Doc, we need to do something, or we need to find out. So that will have to happen.
Any more questions? Dr. Grant?
Yes, good afternoon, and thank you to all the presenters. I thought that the presentations were excellent and quite informative. My question is for Mr. Gray. I wanted to find out, in this rollout, will there be sensitization to the various organizations? I'm wondering if the level of awareness in terms of the responsibilities are there. Thank you.
There has been some sensitization. I won't say that there has been enough sensitization. We're hoping to ramp that up in the coming days. There have been some logistical challenges, I will admit. However, what we have done is we have hosted a forum with the MAJ, and recently there was another forum with medical practitioners. We have had inroads with partnerships with the Ministry of Education and the larger entities that will interface with the Data Protection Act. So there is some knowledge. The broad area which goes down to more knowledge is the actual data subjects, which is you and I, and the protection which the Act affords us, and that we hope to address shortly.
Any other questions from within the room? If not, Dr. Bowen, I have some questions. So in terms of practical application now, so we are saying for the patients, they should know how their data will be used, how it will be protected. They should also be given information on, I think, the risk and benefits of your telehealth, because they must be treated as autonomous agents with the ability to self-determine. How, in a practical sense, do you deal with that, one? And also, you are not actually, well, for some subspecialties, for instance, dermatology, I guess it's good. You can see the skin, you can make that sort of. So for what I'm seeing is that for certain subspecialties that, they lend themselves more to telehealth, telemedicine, there are others that I would be a little concerned about. So just to give me from a practical point of view, so I'm a neonatologist. So a practical point of view, I have a little problem, with a mother and a baby, and you're not actually putting your hands on. So just give us some practical tips on that.
That's a great question. Definitely telemedicine appeals or works better with certain subspecialties. Psychiatry and dermatology can conduct a full consultation for maybe 95 to 100% of everything they treat online on the platform, whereas a general surgeon cannot. So what it is really is that, one, our informed consent outlines what can be treated on the platform. So we kind of narrowed it down to a fixed list of conditions that can be treated on the platform. We also advise the patients what we do not treat on the platform, so they have a better sense of understanding. And we have a disclaimer that if this is an emergency, you're in the wrong place, go to a hospital. And our staff as well are trained to pick up on these things and direct accordingly. In terms of the doctors, they get to preview what they are being faced with. They are therefore allowed to accept or decline if they think that this is a valid telemedicine appointment, or if that person needs to come into office, or if that person needs to go to hospital. The doctors themselves are covered by malpractice insurance, which covers telemedicine, period. It didn't when I launched, and that was scary, but the pandemic, of course, accelerated things, and both MPS and the other, yes, Magif, yes, they have since upgraded their standards, and they do cover telemedicine just like they cover in-office visits. So the doctor usually has to, if they're being, during the screening process, malpractice insurance is part of that to cover them. And then our company as well has malpractice insurance to cover us. The liability, of course, does fall on the doctor and not on the software. And we make it clear to the doctor that, hey, you are the one seeing the patient. You are the one responsible for the patient's health. Yeah.
Following up on that, your platform works outside of Jamaica. What happens when people are doing telemedicine visits in another jurisdiction? So, I mean, I'm covered for practicing in Jamaica, but now I'm seeing a patient in Guyana or New York or wherever.
Great question. And again, when we started, there were no standards, but the standards still allow for it. And we do operate in a few other of the islands. And what the platform has been designed to do is that when the patient is registering, they select what nation they belong to. If you're in St. Lucia and you're on the MD-Link platform, you say, okay, I'm a St. Lucia patient, you click that. And even when you're booking an appointment, you say, I'm a St. Lucia patient. Once you click that, you're only going to see St. Lucian registered doctors. Now, the cool part about that is the CARICOM allows for, or UE allows for Jamaican doctors to be registered in every island. And therefore, you as a Jamaican doctor, you're fully allowed legal to see patients throughout the Caribbean on the platform, covered by your malpractice insurance as well, as long as you are registered in that country. So you just have to have your CMEs submitted and pay the fees, and you're good to go.
Okay, so following on that, you did in your presentation brought in AI, the use of AI in terms of screening, you know, that sort of thing. So are the patients from upfront, do they recognize that they are interfacing with AI?
Again, great question. Our first launch of AI was when the IDB actually gave us a grant during the pandemic to launch a COVID screening tool. And we did put together an AI screening tool. However, we did not have the correct data protection that you are bringing up at the time. Since then, we have not ventured into AI as yet. But now that it's becoming so relevant with ChatGPT, we have no choice but to jump back into it. And again, like my colleague was saying, we definitely will be letting the patients know that, hey, this is not a doctor, this is artificial intelligence. If you don't want to continue, you can switch out, see a real doctor, or you can continue.
Yes, I think, you know, I can see ethical issues around that, and the patient being informed and being given, as you say, to opt in or opt out, you know. So that's a new frontier, and I will look forward to see how that unfolds, but we can see ethical concerns there.
Definitely, and thanks for teaching me that.
Okay, so I think we can all agree that we have been informed. We are learning new things. There's a lot more in terms of ethics and telemedicine, but as Dr. Bowen would tell us, it's here to stay. We no longer can run away and say, you know, we are not dealing with, because it is here to stay. The Data Protection Act is here to stay. And separate and apart from telemedicine, I think we all have to get on board, right? Because at the bottom of what we do, we have to recognize protection of patient data, security, patient privacy and confidentiality, and all of that existed before telemedicine, and it is still, you know, paramount in how we practice. So I would like to thank the panelists, Professor Knight Madden, Mr. Gray, Dr. Bowen. I think it has been a really good session, and it's fitting that this is the way we have closed, you know, our conference. So Dr. Grant, you come in. Okay? Right. Thank you.
We are back. We want to recognize our final panel discussion, the final session for this, our 14th annual National Health Research Conference. We want to really give thanks for the 3 days, and we closed out with an excellent panel. And at this point in time, we want to recognize our panelists as well as our moderator. And so we're going to go ahead and give some very small tokens of appreciation, beginning with our moderator, Professor Helen Trotman-Edwards. And then to our very interesting and excellent panelists, we begin with Professor Jennifer Knight-Madden. We also wish to thank Mr. David Gray. And we would also like to recognize and thank Dr. Che Bowen. At this time, we would wish to close off this conference with our usual awards ceremony. So we are going to have a half-an-hour break. What time is it? So come back at 2:30. Okay, so I'm getting my instructions from my manager. So we're going to come back at 2:35. So we're going to ask persons online, please rejoin at 2:35. We're going to learn who our conference prize winners are. Thank you very much.
Hello, I'm Dr. Shin Young-soo, and Regional Director for the Western Pacific World Health Organization. Today, on the World Health Day, I would like to ask you, how safe is your food? Does your country's food safety system protect you and your loved ones? Does it follow international best practice?
Harmful bacteria, viruses, parasites, and chemicals can contaminate food. Every year, millions of people in Asia and the Pacific are affected by diseases that are caused by unsafe food. Unsafe food causes more than 200 diseases, including acute diarrhea, cancer, kidney failure, brain disorders, and chronic malnutrition. Diarrhea is the most common symptom of food and waterborne illnesses, causing some 2 million deaths a year. The risk of unsafe food crossing borders is greater than ever. Trade in food and livestock products in Asia has increased threefold in the past 20 years. Contaminated food can transport disease halfway around the world in a few days. Food safety is a shared responsibility. Countries must work together to prevent foodborne disease outbreaks. Because food safety assurance is only as strong as the weakest link in the food chain. Food safety incidents also have economic consequences. Millions of dollars are lost every year due to food contamination. Consumers lose confidence in the food and stop buying it. Businesses close, people lose their jobs, and exports decline. Food safety must be a priority, from farm to plate. Governments must take responsibility and ensure that all foods comply with minimal food safety and quality requirements. Otherwise, the health and economic consequences may be serious. WHO helps member states build capacity to prevent, detect, and respond to foodborne disease outbreaks. This includes building national core capacities as required under the international health regulations, and facilitating rapid exchange of information through the International Food Safety Authorities Network, managed by FAO and WHO. Make safe, healthy food a priority. Take responsibility to ensure food safety. This will help your country maintain good health and achieve economic prosperity.
I was first diagnosed with cervical cancer at age 33. The treatment was not pretty. It was terrible. I couldn't go to work, and I spent the whole 5 years out of work. The pain, the struggle, I removed my womb. I thought, I'm finished with cancer. 2016, cancer come back. There's hope for your daughter. My experience don't have to be her experience. So mothers, give their children the vaccine. It will be good for your sake and for the children's sake.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
want to see a Jamaica that is cervical cancer free. Cervical cancer is one of the leading causes of cancer in women in our nation, and I want this to stop. The HPV vaccine has been proven to be the most effective method to prevent cervical cancer. It is a safe vaccine, and it is best to give the vaccine to young girls before they've even been exposed to the HPV virus. So parents, I want to encourage you to let your daughters get the HPV vaccine. Let us protect our next generation against cervical cancer.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
I love my children, and I will do anything to protect them. So that's why, as a mom and as a doctor, I made sure that my daughter got the HPV vaccine to protect her from cervical cancer later in life when she becomes a woman. The HPV vaccine is very safe and effective.
I was afraid of the injection at first, but I got it and it really wasn't that bad after all.
If there was something you could do to protect your child, wouldn't you do it? Protect our next generation. Ensure that your daughter gets the HPV vaccine today.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
What happened, Aiden? My mama told me I need to come off the tablets. Yes, you should. We need physical activity. Well, that's what adults say. Adults, I tell you. Seriously though, with physical activity, we will get better grades, better heart health, and improve the bone health. Oh, I heard it will improve memory and overall mood. Yes, it will maintain our weight and lower the risk for depression. Do you know what will lower your risk of depression? What?
During this time, with online schooling, we are sitting for too long. The problem with sitting for too long is that it leads to soreness, aches, and pains throughout our body.
We're gonna get funky, 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 funky. Everybody clap your hands. Clap, 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 clap your hands. Clap, 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 clap your hands. All right, now, we're gonna do the basic step. To the left. Take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha, real smooth. Turn it out. To the left. Take it back now, y'all. One hop this time. Right foot, let's stomp. Left foot, let's stomp. Cha-cha now, y'all. Now it's time to get funky. To the right now. To the left. Take it back now, y'all. One hop this time. One hop this time. Right foot, 2 stumps. Left foot, 2 stumps. Slide to the left. Slide to the right. Crisscross. Crisscross. Cha-cha, real smooth. Let's go to work. To the left. Take it back now, y'all. 2 hops this time. 2 hops this time. Right foot, 2 stumps. Left foot, 2 stumps. Hands on your knees, hands on your knees. Get funky with it. Oh, yeah. Come on. Cha-cha now, y'all. Turn it out. To the left. Take it back now, y'all. 5 hops this time. Right foot, let's stomp. Left foot, let's stomp. Right foot again. Left foot again. Right foot, let's stomp.
population. Make we rise and immunize all across the nation. The ministry is giving us the motivation to get your infants routine immunization. Protect the toddlers from all diseases. Tetanus, rubella, whooping cough and the measles. Polymyelitis, mumps and the flu, plus tuberculosis to name a few.
Rise to immunize. Eliminating diseases saves lives. Visit your nearest clinic or health center for more information or log on to www.moh.gov.jm. A message from the Ministry of Health and Wellness.
Do your part to prevent mosquito breeding. Mosquitoes will breed in any container that holds water.
Tightly cover water storage containers such as drums, barrels, buckets and tanks. If this cannot be done, pour cooking oil on the water surface. Punch holes in all tins, plastics and beverage boxes to prevent the collection of water before disposal. Cover all tires or fill with dirt to prevent water collection. Scrub all vases once per week to remove mosquito eggs. Use mosquito repellents to protect yourself from mosquito bites. Dispose of garbage properly by placing in plastic bags and securing properly to prevent water collection.
A message from the Ministry of Health and Wellness.
Come pre this you, don't pre that. Let me tell you about the body and some physical facts. Come pre this you, don't pre that. Let me tell you about the body and some physical facts. Physical activity defined as bodily movement. You know it beneficial to every student. Chin up, push up, jogging, sit up, feeling lazy. Better get up. Physical activity help your mood and memory, make you remember anything, cause it boosts dopamine and serotonin. Target attention, focus, regulate moods. Come learn something. Yeah man, listen young youth. Physical activity, healthier weight, go and exercise. Students hold the faith. The more you do, the more calorie your body use. Calorie deficit, calorie get reduced. Exercise build your bone and make it more dense. A facts we attack, ladies and gents. Physical activity is of the essence. Needed like full stop in any sentence. Come pre this you, don't pre that. Let me tell you about the body and some physical facts. Come pre this you, don't pre that. Let me tell you about the body and some physical facts.
During this time, with online schooling, we are sitting for too long. The problem with sitting for too long is that it leads to soreness, aches, and pains throughout our body.
One, two, three, two more. 1, 2. Adults to 30 minutes activity daily. Love your body, treat your body right. Vegetables, make sure you eat plenty. Children do 60 minutes activity daily. Drink some water when you feel thirsty. Cut down dessert and have a smoothie. Jamaicans, love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. One more time now. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. Listen up. Make sure you know your health status. Go a doctor and get a regular checkup. Chronic disease can slowly creep up. We can lower the risk and live up. If we just eat right and get moving, jumping, running, dancing or skipping, change the children, them lazy habit. Make them play out the door and put down the tablet. Jamaicans, love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. Jamaica get moving. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. After 2, make me hear you say I love me. 1, 2. I love me. 1, 2. I love me. 1, 2. I love me. After 2, make me hear you say I love me. 1, 2. I love me. 1, 2. I love me. 1, 2. Jamaicans, love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. One more time now. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. Jamaica get moving. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. One more time now. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. Listen up.
Love your body, treat your body right. Love your body,
The Ministry of Health and Wellness is celebrating Caribbean Wellness Day 2023 with a weekend of wellness. Saturday, September 9th. All roads lead to the University of Technology Jamaica for a sweat fest. 4 p.m. to 8 p.m. Join the 3K Fun Run Walk. Pass through the obstacle course and work up a sweat with the Sweet Energy Fitness team. Admission free. No sign-up required. Lots of prizes and surprises along with free food samples. Come, get your Jamaica Moves shirt. It's a weekend of wellness. Wow, with the Ministry of Health and Wellness.
This is the Aedes aegypti mosquito that spreads the Zika, chikungunya, and dengue viruses. Protect yourself.
Good afternoon. We begin our final prize giving and awards recognition ceremony, and we welcome you back. Each year we celebrate the best of the best, and so for both media of oral and poster presentations, we award prizes for the best overall presentation, the best student presentation, and the most impactful presentation. The most impactful presentation is awarded to research presented that was awarded the highest policy score. And so we need to have a drum roll in the room. Are you going to help us with the drum roll? Thank you. And at this point, I'm going to invite Dr. Karen Webster-Carr, our Principal Medical Officer, National Epidemiologist, who will be handing out the prizes as we mention our awardees. So we begin with oral presentations, and we begin with the most impactful presentation. And this was awarded to Dr. David McGowan for his research entitled A Cross-Sectional Survey of Antibiotic Use Among Patients Admitted at 2 Urban Hospitals in Jamaica. Dr. McGowan. In front of the banner. We're just getting the perfect placement. The next award is for the best student presentation, and this is awarded to Mr. Amarli Wright for his research entitled Combined. I'll just wait for the applause to finish. And so this is for his research entitled Combined Supplementation of S-nitrosoglutathione and glutathione for diabetes treatment. And finally, for the oral presentation category, we have the best overall presentation. And this is awarded to Miss Selena Lewis for her presentation entitled Influence of Health Systems and Patients' Experiences on Self-Reported Medication Adherence in Jamaican and Colombian patients with hypertension, a cross-sectional, cross-country comparative study. A group picture? Oh, so we're being asked for a group picture. So Dr. McGowan, Ms. Lewis, and Mr. Wright, if you can come and take a group picture with Dr. Webster. Thank you. And so we move to now the medium of poster presentations. And the awards are Most Impactful Presentation, Best Overall Presentation, and Best Student Presentation. And there is one winner of all three prizes. And this awardee is Mr. Jordan Eaton for his poster presentation entitled A 5-Year Retrospective Analysis of Referral Patterns and Associated Factors Among Patients on a Consultation Liaison Psychiatry Service at a General Hospital in Kingston, Jamaica. So Mr. Eaton is online, so he will be responding online.
Hello. Okay. Wow. That's okay. Thank you very much.
Congratulations.
Thank you very much. What surprise to say the least.
Okay.
Thank you very much for your consideration.
Thank you, and thank you for submitting your research, and congratulations on being awarded all three prizes. Do you have anything you want to say to the participants?
First of all, major respect to the organization and to the other persons who contributed, and a special thanks to my supervisors, Drs. Martin and Delahaye, and Dr. Walcott. Without any of them, I would not have been able to do this, and I'm just grateful that we have been able to make an impact in the treatment of mental illness with patients across the country. So thank you very much.
All right, thank you, and congratulations again.
Thank you.
And so we now move to the end of our session, and the end really is the point at which we want to give thanks. So as we come to the end of yet another successful event, we hearken back to the words of our Chief Medical Officer in her greetings, where she indicated that these events provide an opportunity for reflection. And so we look back to 2020, where when we were faced with the gathering restrictions as well as the demands on the Ministry of Health and Wellness with respect to the response to COVID-19. The Secretariat then pondered whether we should have the event. Some of the team in their wisdom suggested a virtual event, and this was endorsed by the leadership. To date, that year, which was 2020, was the most successful year in terms of the number of attendees, which shows that sometimes in the midst of challenges, this brings to birth innovative solutions. Believe it or not, this is the 4th year of our virtual conference, and this is our 2nd year in which the virtual experience is facilitated by VFairs. And so we want to just give a round of applause to the VFairs team and to give thanks with respect to our virtual platform. We are thankful for the wonderful and interactive platform and for the assistance and professionalism of the VFairs team. The product that you have seen and experienced over the last 3 days is as a result of many months of planning, and the various components of the event have passed through many hands in order to garner success. We are grateful for the continued support and for the persons who have been here from the beginning. It is good to see the event grow each year from strength to strength. We would like to begin with a word of thanks to the executive management of the ministry, and the support is evident through their presence in our opening ceremony, through the special presentation by our permanent secretary, and through their endorsement of all the activities in the background. For our opening ceremony, we wish to thank our Honorable Minister of Health, Dr. Christopher Tufton, and our Chief Medical Officer, Dr. Jacqueline Bisesa-McKenzie. We wish to thank our partners who brought greetings, namely Dr. Joy St. John, Mr. Ian Steen, Ms. Adeyelu Asekun, and Dr. Wayne Henry. We wish to thank our excellent Master of Ceremonies, Ms. Delia Harris, and our musical performers, RSI Steele and Mr. Kareem Chang. We wish to acknowledge the members of the Spiritual Wellness Committee who helped us to start each day in the right way by invoking the presence of God, and we thank Ms. Takis Fogel, Ms. Sandra Parchment, and Mr. Stephen Davidson. We would like to thank our special and spotlight presenters, Professor Marvin Reed, Dr. Irvin McKenzie, Dr. Nicole Dawkins-Wright, our permanent secretary, Mr. Dunstan Bryan, and Dr. Leroy Campbell. Our panel discussants, Professor Afet McCaw-Binns, Dr. Orville Morgan, Dr. Carol Lord, Professor Jennifer Knight-Madden, Mr. David Gray, and Dr. Che Bowen. Our special presenters, Mr. Cameron Bennett, Dr. Keisha Barwise, Dr. Derek McDowell. Our concurrent session presenters, Mr. Stephen Davidson, Ms. Dion Keynes, representing the Nutrition Unit, Mr. Marvin Lawrence of RADA, and the Mental Health and Substance Abuse Unit with respect to the Wellness Bench. We want to acknowledge and thank our moderators, our own Dr. Karen Webster Carr, Professor Marvin Reed, Dr. Gail Everin Carr, Dr. Melissa Royal, Dr. Kamisha Shaw Kelly, Dr. Nicole Lofami, Mrs. Pauline Spencer Smith, Dr. Bradley Edwards, Mr. Michael Williams, Dr. Kevin Goldburn, Dr. Tasmoy Crawford, Dr. Julia Rowe Porter, and Professor Helen Trotman Edwards. We also wish to thank our judges, and we recognize that this has taken a great amount of time and effort. So we have seen the fruits of the awards in terms of our awardees, but in the back end, we had our judges who were attending each session and adjudicating. And we want to recognize the time and effort that this took. And so we are going to invite Dr. Karen Webster-Carr to come back to help to hand prizes to our judges. Mrs. Mullins, we have the prize for the judges. And we have representatives of our judges here, so we are going to name the persons who are still present. So we begin with Mrs. Karen Nelson. Okay, so repeating again, so for our first judge, Mrs. Karen Nelson. We also recognize Mrs. Gillian Mason Quarry. So what I would ask in the interest of time is I'm going to call up all the oral presentation judges. So we had Mrs. Gillian Mason Quarry, Dr. Patience Alonge, and Dr. Sharon Dawson. We also recognize Mrs. Shireen Huntley-Jones, who is unable to make it to this final session. We now move to our poster presentation judges, and we want to firstly recognize our Chief Judge, Ms. Romay Tharp. Our other judges, and so I'm going to ask you to line up, please. Dr. Shelley McFarlane, Miss Ashley Bingham, and Dr. Ian Campbell, who is not here. As you may appreciate, this planning process started many months ago and involves a lot of moving parts, including procurement. And we want to thank the Finance and Accounts Directorate, as well as the public procurement team of the Ministry of Health and Wellness for their assistance in this regard. We would also like to acknowledge the work done in preparing and selecting the research team, and we would therefore wish to thank our team of adjudicators. I'm going to call all the adjudication, and we're going to have one photo up with Dr. Webster. So our adjudicators, those present in the room, Dr. Shelley McFarlane, Dr. Kevin Goldburn, who is not here with us, Mrs. Patricia Ingram Martin, Dr. Patience Alonge, please come forward, Mrs. Stephanie Bernard Stevens, Ms. Romay Thorpe, Dr. Ian Campbell, Dr. Tasmoy Crawford, Dr. Sharon Dawson, and Mrs. Tanil Mullins. So we're going to have one photo up. And also myself. Thank you. Last but not least, we have three very critical groups that we have to mention. Firstly, we could not do anything without this fantastic team, and that is the 2023 Secretariat. We have a few representatives here. What I normally say is that once you join the Health Research Conference family, you are part of the family for life. And generally, we have persons who have supported us from the very first conference. At this point, it may be a bit tedious, but I don't think that this event would take place without this team, and so I'm going to read each name. And as your names are read, please, I'm going to ask the persons present in the room to come forward, please. So we have Mr. Stephen Davidson, Mrs. Nicole Martin Chen, Mr. Hector Burrows, Miss Romay Thorpe, Mrs. Tanil Mullins, Miss Deborah Henningham, Miss Anna K. Byfield, Mrs. Samantha Smith, Mr. Jovan Wigan, Mrs. Karen Nelson, Miss Samantha Anderson, Mr. Brandon Christie, Mrs. Ashley Bingham, Mrs. Stephanie Bernard Stevens, Dr. Ian Campbell, Miss Fiona Henry, Miss Kimberly Nain, Miss Nigesti Williams, Mr. Jerome Morant, Miss Anna K. Howell, Miss Leslie Ann James, Mr. Jason Lawrence, Ms. Tanika Edwards, Mr. Chadwick Wright, Ms. Rory Ann Rose, Mrs. Stacey Ann Williams Maitland, and Mrs. Renee Brooks. We also want to recognize a special person. This is going to be a surprise. But there is a particular person who really had us on the reins this year. She really was the chief cook and bottle washer. And I think it would be remiss if we did not specially recognize her contribution. And so I want to specially recognize Mrs. Tennille Mullins for the work that she has done. Thank you for bearing with us. We're almost at the end. We also want to recognize our researchers as we celebrate the hard work that was put in. We realize that we have seen and heard, what we have seen and heard would have been the outcome of many months of hard work. We thank our 21 oral presenters and our 13 poster presenters. We particularly recognize our poster presenters as we realize the work taken to structure and produce poster presentations. And lastly, we recognize you, our participants. This function would not be possible without you. We have a family of supporters, as was mentioned, who have been with us from the very first year of the event, and we have two of those persons actually inside the room, Dr. Sharon Dawson and Dr. Shelley McFarlane, who have been supporters from year one of the conference. So we thank you. We also thank those who have joined us for the first time, and we invite you to continue to join the event from year to year. Remember to place in your calendars for next year. The National Health Research Conference is the 3rd week of November. So place it in your calendars. See you next year. Thank you very much.